सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 8448440632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 8448440632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 8448440632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 8448440632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 8448440632। सोच में सकारात्मकता लाएं।
Hello, Mohan ji. You can see, no? Oh, good. Thank you. Yeah.
जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 8448440632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने, 8448440632। 0632. सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632।
Regional workshop on mental health and well-being, concerns and strategies. Today we have 3 sessions and a validatory session at the end also. So for the first session, we are joining with Dr. Aradhi Bell, who is a psychiatrist at Apollo Hospital, Mysuru. In order to introduce the guest, may I request Lahari to introduce.
Good morning, all. Respected dignitaries on the dais and those who have joined online, participants and dear students. It is our pleasure to uh, invite and introduce Dr. Aarti Bell, psychiatrist in Mysore. She has an experience of 25 years in this field and she is currently working as a consultant psychiatrist at Apollo Hospitals, Mysuru. She has completed MBBS from Tanjavur Medical College and MD Psychiatry from Kasturba Medical College. She has worked as assistant professor in Department of Psychiatry, Kasturba Medical College, Manipal. She is a member of Indian Psychiatric Society. Some of her services include student stress management, quit smoking, smoking cessation, etc. She has presented various papers in national and international conferences. We welcome you to the workshop, ma'am.
Thank you. Good morning. Am I audible to you and the online members? Is it okay if I sit and present, or do you want me moving around?
Yes, ma'am.
I wanted to be convenient for the relaying of the thing, that's all. Is it okay, sir? Yeah. I'll start from here. Okay. At the outset, I would like to thank the organizers of this workshop for having me here. I have been long-term associated with RI, and it's always a pleasure interacting with all the teacher faculty over here, because I truly believe that, if we start young, okay, we can take children a long way. Mental health concerns are a big thing. There's a lot of stigma attached to mental health illnesses. So if we start making it a norm in our schools, and if we introduce them at a young age, I'm sure over time we will be able to get rid of the stigma that we have been fighting for as mental health professionals for a very long time. But I'm sure you as teachers have a big role to play in this, and I welcome you all to this workshop. Next slide, please. I thought I will start off with the introduction of the psychiatric disorders per se among children, which are the common ones. Okay, so I'll not be speaking about all of them per se, but the common ones that are associated with children. I'll talk about the little time interventions that you as faculty members, as teachers, can do at your level in schools. Okay. Also, then after that, I'll talk about a little bit about life skills, how we can impart to our children and make them more sturdy and more resilient, when it comes to mental well-being and the concerns thereon in future. So, psychiatric disorders are quite different from medical disorders. Don't we all agree to that, right? In this, we deal with abnormalities in thought, behavior, mood, and perception. Okay, so how they perceive the external world. Next slide, please. In this, the causes of these could be multiple. Genetics is one, that we are born with certain genes, we can't avoid it. So that is a primary cause. Developmental issues. So when the fetus is being developed in the mother's womb, due to various infections, due to pregnancy-related hypertension or diabetes, which cause a lot of changes in the fetus. Also, at the time of birth, any kind of asphyxia, that is low oxygen level, which could also lead on to a lot of problems in the development of the child. The environment of the child is very important. Okay, so we talk less about environment than other physical illnesses, but in psychiatry, we do talk about the environment, the influence of society and culture, that is the psychosocial factors, the biological factors per se, that is the neurochemical changes in our brain, the hormonal changes that bring about many psychiatric disorders, and the temperament or the personality. So you must be seeing, two children failing in the same class, but one child, taking it up, oh, I'll see next year, what big deal in that. The other one going and attempting suicide. What is the difference between the two? I mean, the same, problem they came across, but both their reactions was quite different. It all depends upon the temperament of the child. And stress, obviously, causes a lot of psychiatric disorders. Next slide, please. So, how does child psychiatry in particular differ from adult psychiatry? Children are usually brought to us by elders in the family. So, it is their perceptions which we listen to. So, take for example, a very strict father who doesn't believe in, child going from this place to the other, even, shaking his legs here and there. he brings the child to me, saying that my child is hyperactive. Okay, we have to look at everything in the context. Okay, we have to look at the child separately, the father separately, and then their relationship with each other, how their personalities are matching. So psychiatric problems in a child may be a manifestation or disturbance of other members in the family also. We should look at that. The other thing is great attention must be paid to the stage of development in deciding whether the child is abnormal or he's normal according to the developmental stage. At 3 years of age, if a child is being brought to me saying that, he's not writing well, should I entertain it or not? Is this the developmental level that, the child should be writing well? So all these things have to be taken into consideration. Children are generally less able to express themselves, in words. So the evidence is usually brought to us by their behaviors, by what we see externally rather than, what is going on internally in their mind. Treatment of children, we make less use of medicines because there's a lot of behavioral therapy that is required in them. So a lot of modification by retraining children, by working with parents. We associate with a lot of teachers in this goal. Due to their cognitive and linguistic immaturity, they cannot express themselves very well. So techniques of psychotherapy have to be slightly changed compared to adults because of, individual needs of the child. So how do we diagnose psychiatric disorders in children? These are the two major classifications. One is the International Classification of Diseases that is compiled by the WHO. And we all know that Americans want to do everything differently. So they have a different classification, which is known as Diagnostic and Statistical Manual, which is very closely related to ICD-10. So disorders in children, mainly we classify it into 3 forms of disorders. One is the emotional disorder. Next slide, please. Emotional disorder, that is the anxiety, depression, and phobias. So in these emotional disorders, most of these things, they are internalizing disorders in which the child suffers internally. Yes, we see manifestations of it outside, but not so much as the kind of problems that are happening inside the child. So we have to talk to them and get, their emotional aspects out. The second variety is the disruptive disorders, in which we see a lot of problems on the surface. They are known as externalizing disorders. So we see, a lot of restlessness, we see a lot of conduct problems, lying, stealing, breaking rules, all those kind of things we see in the disruptive class of disorders. And the third form is the developmental disorders, which I told you, could be because of some kind of an insult that the fetus suffered when he or she was in the mother's womb or at the time of birth. So the emotional disorders are classified, have all these categories of problems like anxiety, depression, phobias, obsessive compulsive disorders. Disruptive ones are the conduct disorders, the hyperactivity or the ADHD that we call, or the oppositional defiant disorders. And the developmental disorders are mental retardation, autistic syndromes, learning disabilities, all such disorders. Next, so coming to emotional disorders, we see that, so we'll discuss a few cases in this regard so that, you are more well-versed in detecting cases and then, handling them. Case 1 is that of a 14-year-old girl who was social, good at studies, and actively participated in class activities. She's noticed to be dull since the past 1 to 2 months. She does not talk much with others, remains aloof, and does not take part in class discussions like before. Her grades are slipping down. Teacher observes cut marks on her left wrist. What could it be? Anything? Suicidal attempt, very good. So what could the child be suffering from? Depression. So in depression, we see sad mood. Sad mood, we don't classify sad mood as in, my teacher scolded me, so today I felt low, tomorrow I felt low, and I'm fine tomorrow. It's sad mood lasting most of the time for at least 2 weeks to classify it as clinical depression. So it's a pervasive sad mood which affects all aspects of the child's life. There's anhedonia, that is, just lack of interest or enthusiasm to do anything. All the activities sound dull and boring to this child. Energia is something which is, lack of energy. Next slide, please. Next. Yeah. So there is disturbed sleep along with that, reduced appetite, reduced libido, reduced concentration, which then affects the memory. There could be crying spells, anger issues, low self-esteem, low confidence, helplessness, a sense of hopelessness, death wish, and suicidal ideations. We see these cut marks very frequently in children. So if it is happening, please be aware. It is like a sign for the child, going into depression or, having something serious going on in the head. Inform the parents immediately, take mental health professional help. The other disorders falling under the, next slide please. Other set of disorders falling under the emotional disorders category is the neurotic or the stress related disorders. These are phobias, so excessive fear towards anything. So even then when the patient or when the child thinks of a situation like that, say blood, darkness, an animal, height, water, anything it could be, that would create a sense of anxiety in the child. And that would prevent the child from facing the situation. He would start avoiding that situation totally. Okay. Then the other set of disorders is the panic disorder, in which there are sudden attacks of panic or anxiety, which come down on their own. But at that time, the patient thinks that, I'm going to die, there's something serious that's going to happen. And they have a sense of fear that when will it come again? So that is panic disorder. Then there's generalized anxiety disorder, in which the child is forever restless, edgy, anxious, restless most of the time. Then there's something which is known as obsessive compulsive disorder, in which they get repeated thoughts of, either, for example, cleanliness. So they'll think that, I washed my hands once, but I'm not clean enough. So they go on washing their hands. Or checking something, writing, scribbling again, cutting it off. Okay, again, rewriting it. Or checking the roll number several times, more than what is required. Getting, unwanted thoughts about, something bad happening to a family member, or getting blasphemous thoughts about God. And then they try to neutralize it with something like washing of hands, going and checking, and trying to do something to lower their anxiety. So that is obsessive compulsive disorder. Then there's post-traumatic stress disorder. This is generally in response to a big trauma that has happened. It could be sexual abuse, it could be a burglary, it could be, seeing some accident or seeing a murder in front of their eyes. That would lead to flashbacks of the events, causing a lot of distress and anxiety in the child. Then there are dissociative disorders. You must be seeing, children frequently fainting and falling off. And when they are checked up by doctors, doctors come back and tell you that, this is nothing, there's nothing wrong with the child. Okay, there could be an underlying repressed, some kind of stress going on in the child's life. Also, they could start talking like someone else, You must be seeing many children, they start talking as if like an adult during phases. They don't remember those phases. So it is not something that they're doing on purpose. It happens because of a underlying unresolved conflict or stress that's going on in their life. Next slide, please. So this is case 2. That's of a 12-year-old boy who's shy by nature, very good at studies, but avoids all extracurricular activities, especially if he has to give any presentation. He starts trembling at the thought of it itself. He designs great projects for science exhibition. Yeah. Hysteria, so it was, an earlier classification. These days we call it as dissociative disorders. That's what I referred to, yeah. So he avoids all extracurricular activities, even the thought of going up on stage, he starts trembling. He designs great projects for science exhibition, but avoids explaining. He pushes his friends that you go and do the explanation bit of it. And when he was once forced to give a presentation in the assembly by the class teacher, he made an excuse and didn't go to school at all that day. What could this child be suffering from? Anxiety. What kind of anxiety? Performance anxiety, very close to it. So we call this condition as social phobia. Now imagine this child, if he were to grow up like this, in today's world, it's so difficult to survive, right? Okay, we all have to go in front of others, give presentations, like we all know that these days, your academics alone is not going to play any role in life unless you have something to show it off. So we need to, improvise on the skills of this child and make him come out of social phobia. So phobia is an excessive and unreasonable fear of a situation. So situation like, social performance, or it could be height, it could be water, it could be even snakes, reptiles. Many children have darkness they have fear of. They start trembling at the thought of it itself. So exposure to the object provokes a lot of anxiety. They have a lot of panic attacks, and so they avoid the situation totally. But avoidance is further going to go on increasing the problem. It's not going to reduce the problem. Next slide, please. This is of a 12-year-old girl who gets sudden attacks of palpitations, giddiness, breathlessness, and sweating. She fears that something fatal is about to happen to her, that she's going to die at that instant. She becomes normal within another 10 to 15 minutes on her own, even if nothing is done, no medical intervention is taking place. She's scared that she may get another episode anytime, and she becomes close to her family. She says, "Don't leave me alone." She doesn't want to go to school because of that. She fears that, what if I get an attack? What if I die in school? What could this condition be? So she's getting these sudden spontaneous attacks of panic. We call this condition as panic disorder. Okay? That could happen, but even otherwise it can happen on its own. Yes, that is also related to it. Yes. So the panic attacks could be, associated with any other form of anxiety disorders, or they could be even associated with depression and all that. But in this condition, when a patient is absolutely normal and they get these sudden attacks of anxiety, and after all the medical problems are ruled out, we call it as a panic disorder. This happens due to certain neurochemical changes in the brain, the serotonin, noradrenaline coming down, which causes these problems. Unknowingly it occurs, yes. Child. Yeah. The first time, yes, we need to rule out any underlying medical disorders, but once it is ruled out, it is labeled as a panic disorder. Yes. So next slide, please. Panic disorder, this is sudden unprovoked attacks of anxiety, which are known as panic attacks. The patient is absolutely normal in between the attacks. Okay, so they'll come and tell you that, ma'am, I was just sitting and having my tiffin and suddenly it started. So they're not thinking or, contemplating about something that's going on in their head. It just happens out of the blue. Ma'am, there are several things to it. So it's by counseling, by relaxation methods, by telling them to face it and then gain confidence over it. So slowly they develop confidence about the panic attacks. So there's anticipatory anxiety in which the child feels that, when will it happen again? And then they start avoiding going out alone. They start, limiting themselves to becoming homebound. There's fear of impending doom, that will something serious happen to me. They have a fear about it. Next slide, please. So this is a 15-year-old boy who's seen doing repeated actions like touching his book 3 times before opening it. He will not open it unless he touches it 3 times. Keeps scratching and rewriting whatever he's written, although he's written it absolutely right. He comes back to check his desk after the bell rings. He goes out and comes back again every day to check if he's left behind anything on his desk. He cannot concentrate on studies like before. What could he be suffering from? Obsessive compulsive disorder. Usually OCD, is a condition which starts off in childhood, and then, people just keep it suppressed, or they handle it somehow by doing the compulsions, by going and checking. It has. Okay. So in these cases, they keep coming and they keep, settling themselves down, neutralizing their anxiety with the help of doing their compulsions, and they handle it somehow. But sometimes it goes out of control, and then they do come to us in this age, but most of them appear to us, much later on when they've lost a lot of things in life, and then they come to us. We talk about control in psychiatry, ma'am. Yes. Yes. So if the rituals are acceptable socially, Okay, to an extent, it is not interfering your activities of daily living and not interfering and taking too much of time, it is okay. But then if it goes on too much and then you start believing that if I don't do this, something really bad will happen, then definitely it is a problem. Next slide, please. So we have this OCD or obsessive compulsive disorder in which they get recurrent, distressing, intrusive thoughts. So they're intrusive to the extent that they'll be doing something else and suddenly they pop up inside their minds. They could be thoughts, images also, images like, someone close to them dying. Most of these children, they get these images of parents' death and they get very scared. They don't tell for so many years because they think that, how can I talk about, my own parents dying in front of them? So they get images. Yes. Yes, they can. Yes. And they have impulses that, what if I go and harm someone? So if they see a knife in front of them, they think, what if I go and just kill someone? They know that it is wrong. I shouldn't be doing it. They will never do it as well, but they get these impulses. They are a person's own thoughts, but they have no control over them. It causes a lot of distress. Imagine getting these repeated thoughts all the time when you don't want them to be there. To reduce the distress, person has to neutralize them with some kind of compulsions, then they feel relieved. But by doing so, they further propagate the cycle of OCD. So we have to break the cycle of OCD by stopping the compulsions. Next slide, please. So this is an 11-year-old girl who has been absenting herself from school very often. She complains of stomachache often. She has seen several doctors. All investigations are normal. Now, many a times we think that, the child is wanting to only skip school or not wanting to come to school. It could be one of the reasons. I'm not denying it. But many a times, we just label it as that and we think that, the child is just feigning or malingering. Now, there's a difference between feigning, malingering, and next slide, something which is known as somatoform disorders. Yes. So in somatoform disorders, the child keeps having some form of physical pain. Okay, it could be anywhere, right from the head to the toe. The investigations would be normal. The child would have consulted several doctors, which would all be normal. And the symptoms are not feigned, remember. It is because of, again, an underlying repressed kind of an anxiety or stress, which is troubling the child. So it takes a very long time actually for us to discover what the stress is and then work on the stress and then, relieve the child of this pain. Next slide, please. So that was what we call as emotional disorders. Now we'll talk about the, They frequently visit doctors. Changing also. And several investigations would have been done. So when they come to us with this thick, file. It's, it's very difficult for us to go through those files and see what they are. But anyway, they feel normal for a day. Again, the symptoms start. So it's like, They don't trust. That's why they keep frequently changing the doctors also. Yes. Okay. So the next category of disorders is the disruptive disorders that I told you are externalizing disorders. So in which we see the problems outside, on the surface. Okay. Less inside, more outside. Okay. So we'll see this case. Next slide, please. Yeah. We see this case of a 15-year-old male child who has been breaking rules very often. He gets into fights with others. He has signed his father's signature on the report card once. He's gotten caught about it, but he has no remorse about it at all. He has stolen an expensive pouch from a classmate, again got caught, but again no remorse at all. He gives some explanation that, it just landed up on its own in his bag. What could this child be suffering from? ODD, very good. So it's, yes, conduct disorder. So oppositional defiant disorder and conduct disorders are something which are very closely linked to each other. Oppositional defiant disorder is a little less category of a problem, and conduct disorders are something which is much more. Okay, so but they both are very, very closely associated. So oppositional defiant disorder, in this the child loses temper very frequently, argues with adults, refuses to comply with requests from adults, blames others. So rules and regulations are a big thing with them. They cannot stick to them. Blames others, easily annoyed by others. So he doesn't see where he is going wrong, but he'll keep finding faults with everyone else. Spiteful and vindictive. Something small happens and they'll just get back. Angry and very resentful. Like I said, conduct disorders is a bigger, more severe category of oppositional defiant disorder, in which we see even cruelty towards animals or other people. So cruelty in the sense like they get physically abusive towards them. There could be severe destructiveness to property. So in your washrooms in the school, they'll go and they'll break something, they'll break a tap or something, whatever. Fire setting also we see in this. Stealing, repeated lying. Okay. Truancy is there. Severe temper tantrum. So you tell them something, they're not ready to, give in, they don't have an explanation, they just blow out of proportion. Persistent, severe disobedience. Okay. They're like your charge sheeters of your schools. Yes, I'll talk about it, yes. And when we have to start the correction at this stage, yes, movies, advertisements, all these things do play a big role, especially at this tender age, because they are unable to, hero worship, plus they don't have that kind of maturity to differentiate, where my actions are going wrong and, what I need to do about my actions. Yeah.
So one or two boys may be suffering from this.
Yeah.
But it is seen that in schools, so many will accompany them.
Absolutely. Mm-hmm. So they are the leaders. I mean, wherever they gang up, they will be gang leaders. So, they'll try to boss over others. So,
Early in North India, I found that during the closure of the schools, every light will be
broken.
washroom, everything, every tap will be broken like that.
Correct.
So I felt that it may not be a disorder. So maybe one will be doing that and others are following.
So, why should the others follow? Is because, this person has so much of an influence.
Bossing over the other.
Manipulation. So that itself, brings about changes. So that, okay, so the people who are like sheep following them, they just follow.
So it becomes
for the sake of
mob psychology.
Absolutely. No, it's a very difficult disorder to treat. It is. The prognosis is not too good in these cases. It's really, it's a poor prognostic problem. Attention seeking to an extent when, you are trying to rectify them and they don't want to, get rectified, or when they know that they're going to get caught, they'll do something which is more disruptive to minimize the previous problem. So they may land up and do those things as well.
Attention seeking due to this it is becoming.
Yes. There could be even drug abuse in these children at a very early age. So these are the children who go into drugs at a very early age. They bully, they intimidate others that, if you don't follow me, I'll see you outside the school. And that is why those other sheep, they follow them blindly. There could be even history of running away from home. These children are more likely to perceive hostility in others' actions. So they will not see where I went wrong. Okay, so if they go and disturb another child and the other child speaks rudely to this child, first child, this first child will actually highlight the problem of the second child. He will not say that I went and disturbed this child. He will say that, he came and spoke to me badly. So there is, and they don't want to show where they went wrong. They'll only highlight the other person's problems. They exaggerate their peers' aggressiveness, like I said, underestimate their own aggressiveness. So they don't think that they are going wrong because they have no, sense of remorse, or they don't even think twice about, their own actions. Aggression is frequent in their families as well. That those are studies which have proven it, because we see that, a lot of male members in the family show a lot of aggression. And they have difficulty in solving social problems. That's the reason they resort to, fighting aggressiveness, and they choose aggressive solutions to most of the problems. In this, we teach them self-monitoring of behavior, their own behavior. I'll just talk about the life skills towards the end. In that, we teach them how to monitor their own behavior, how their response should be, how they should think what the other person is thinking or why he's doing such a thing, and then respond likely, in a likely manner. It could be. Like, these are studies which have been proven in these children. Next slide, please. Yeah. So at our level, we can just help them in self-monitoring of their own behavior, make them, point out where they are going wrong, or they can modify those things, what things are modifiable and what are in their hands. Social perspective taking is by case vignettes. How do we take cases? So we say that, okay, this person came and hit you today in the playground. How can you respond to this? Okay. So we take up cases like that, generally form groups of people, 4-5 groups, 4-5 children together, and we tell them, like, now respond to us. If this person comes and pushes you today, what all will you do? So this is the way, we try to teach the conduct disorder child that, there are other ways of response as well, rather than. Absolutely, empathy has to be developed in these people. Otherwise, it gets very difficult. Anger control training also should be taught to these children. So, they have to be told about those self-control trainings, how to identify the first emotion, that I felt upset is the first emotion and next comes anger. So how to convey that first emotion to the opposite party rather than only showing your anger. And problem-solving skills has to be taught to them through games, through discussions, through group interaction with their peer group, so that, they're made to realize that there are other ways of solving this problem. There are other children who are solving these problems in a different manner and are more popular. So, they will also be concerned about their popularity. Absolutely. That helps them out, definitely, because then they start looking at everything in a neutral manner rather than in a very, very personalized or subjective way. Definitely. Next slide, please. So this is a case of an 11-year-old boy. He disturbs the class by fidgeting, moving around restlessly, talks excessively, and disturbs others around him. He speaks out of turn, so even before your question is over, he'll speak and start giving the answer. Gets hurt often in the class and playground. What could this be? Attention deficit, ADHD. Okay, so hyperkinetic or attention deficit hyperactivity disorder. Next slide, please. So in this, the child has impaired attention and hyperactivity that is detected before 6 years of age. It should be evident in more than one situation. So if he's hyperactive only at school and not at home, we don't diagnose it as hyperactivity. So we employ definitely the same kind of methods to treat them, but we don't diagnose it. It could be the inattentive type. So the child can sit in one place, but he cannot focus on the books. It could be a hyperactive, impulsive type in which we see a lot of, restlessness in the child, or it could be a mixed type. Mixed type is usually the common type. Next slide, please. So in the inattentive type, the child fails to give close attention to details. So you give them that coloring task, they'll always go out of the line. So you tell them to color within the lines, they cannot do it. Difficulty in sustaining their attention. He does not seem to listen, okay, because his thoughts are running so fast, he's somewhere else before he can listen to you. He does not follow through your instructions correctly. There's difficulty in organizing any task. Often loses his things, eraser lost, pencil lost, every day something or the other is lost. Easily is distracted by external stimuli. Okay, so anything that's going on, a construction activity outside, he'll keep focusing on that and keep coming back. So his focus on inside the classroom will be less. Next slide, please. The hyperactive or the impulsive type, this child is fidgety, often leaves the seat in the classroom, runs, climbs excessively, he'll be going up and down everywhere. There's difficulty in engaging in leisure activity, which makes him, just relax and tells him that, sit in one place and, relax or do mindfulness. This child will not be able to, very difficult. Talks excessively as well, blurts out answers before the question is complete. interrupts or intrudes in others' job. Next slide, please. So in this, we provide a more orderly and structured environment for these children to reduce overactivity. Best thing is to handle them in small groups, but I know it's not always possible in classrooms. There are behavior therapy programs for the, along with the parents for the child. CBT for the child itself, I'll just talk about a few reinforcement techniques and all in the latter slides. Extra help in class. No, sorry, it's cognitive behavior therapy. I'm sorry, I didn't mention the, okay. So cognitive behavior therapy with the child, and they need more instructions and reinforcements, extra help in class, which if it could be given, a reward system that I'll be talking about, time out again I'll just be talking about, and a stop, think, do approach. So tell them that, before anything, any reaction, stop, think, and then do. So teach them these three words. Next slide, please. So we come to the developmental disorders. Like I said, these, we find problems existing right from birth. So you may not be coming across so many children of this category in your classrooms except in special schools. Next slide, please. This is the first category is pervasive developmental disorders. That is, it includes the autism spectrum disorders, the Rett syndrome, Asperger's syndrome, atypical autism. All of these are included in this pervasive developmental disorders. There's abnormalities in communication and social interaction. Sometimes we get a history in these children that up to 3 years of age, the child was growing normally. After 3 years, there's a sudden decline, both in speech and in non-verbal communication as well. Okay, so this will manifest usually, by the, no ma'am, not possible. So it manifests before the age of 5 years usually, and it's more prevalent in boys than in girls. Next slide, please. So there's impairment of reciprocal social interaction. Now, whenever we talk to someone, we usually have, eye contact, or, even if not too much of eye contact, at least the person will nod or, show that I'm interested in your conversation. But this child will not show any eye contact. So even when the mother goes and hugs the child, for the child, it will be like just a normal phenomena. It is not that the child doesn't have emotions. The child does have emotions, but he or she does not know how to express it out. Okay, so that is where the problem lies in these children. So they have this autistic aloneness. They are by themselves. They don't mingle around with other children of their age group. There's absence of eye-to-eye contact, lack of response to others' emotions. So you praise the child also, the child will not look very happy. You scold the child will not look very sad. Again, the child cannot convey those things to you. It is not that the child doesn't have it. So they convey it in a different form, which comes out in the form of aggression or something else, which we misinterpret as adults. The speech is poorly developed. There's repetition of words. So there'll be echolalia. They'll go on repeating the same kind of words over and over again. Lack of imaginative play, like we see in normal children, they imagine a lot of things and they play, they lack it. Obsessive desire for sameness. So they want their room to be in the same manner. If you change the structure, their desk or the bed from one side to the other, they'll suddenly get, very restless and very irritable. Bizarre behavior and mannerisms. So they'll be flapping their hands or, head banging or biting themselves. All those things may be there. Usually associated with low IQ. I don't say that all children of autism have low IQ, but usually associated with low IQ and many a times also associated with seizures. Next slide, please. The next category is mental retardation, in which we have sub-average general intellectual functioning. Yes. Savant skills. Yeah. Many of them have, but not all. So it's a misconception that all autistic children have it, but many of them do have savant skills. So they may be very good. Like one of my patients has the skill of telling, if we tell him a date, he tells which day it was. So if we tell him that, 2nd October 1970 was, which day, he's able to tell. So these kind of savant skills are there in many children. Many of them are very good at singing. Their musical tone is very good, but not all of them. Not all of them. So mental retardation, this is defined as significantly sub-average general intellectual functioning which is accompanied by limitation in adaptive functioning also. Okay. So at least in two of the areas, like communication, that is, how verbally or non-verbally they express, self-care, home living, social and interpersonal skills, work, leisure, health and safety. So either two of these following areas also should be included in the definition. Next slide, please. So this is the way we calculate the mental age upon chronological age into 100 is the IQ. And the various classifications of IQ are these mild, moderate, severe, and profound categories. So why I'm pointing this out is that in severe and profound, we can't do much. Okay, all we have to give them is supported, living. But mild, definitely we can do quite a bit. Okay, and moderate also. Moderate, at least we can get them to a level of self-care, that amount of training. But in mild, we can even teach them small, simple skills. Very, very ordinary kind of skills like paper bag making and all you must have heard, like many children do. These things can be taught to these children. Next slide, please. The diagnosis has become better, I should say. Also, many of the times these children are unable to express themselves. So even their physical problems actually go unnoticed by parents. These days, parents have only one or two children. So even the small amount of changes in the physical health of a child, they'll immediately bring it to the notice of the medical, attention. But in those days, where there used to be, 5 or 7 children, this one child not feeling well would just be, neglected and just put aside. So diagnosis is better, their survival has become better because of the involvement of the society as such. This is another case of a 10-year-old boy who has good communication and social skills, good self-care, but he has problems in studies. He's able to follow what the teacher teaches orally. So if whatever you say, he's able to, respond back and tell you analytically whatever you have taught. But he's not able to read by himself and understand that well to even write it down. So if you ask him that read this chapter, he'll not be able to produce it. But if you teach that chapter orally, the child will be able to tell you everything properly. He comes up with a lot of spelling errors in his notebook. What could this child be suffering from? Learning disability, yes. So specific learning disorders are there. It could be, pertaining to anything like reading, writing, arithmetic. Child is good at all other skills. So self-care, managing himself in the society, communication with others, playing with other children, everything is fine. Only, there's academic problems. So this child will require assessment, training, and they do have certain privileges in exams as well. Next slide. Calculator, mathematics they have, yeah. So tic disorder is I'm talking about other disorders now, which are seen in children, in which we see, the child frequently either flipping one eye or, just shrugging the shoulder again and again. Sometimes they have this vocal tics as well, in which they blurt out something in the middle of the class and they say, ma'am, it's not under my control. Hitchkey, correct. So that is what, we see in tic disorders. It's very frequently associated with obsessive compulsive disorder. Next slide, please. Enuresis is another thing that we frequently come across in school children, in which they have this night bedwetting, repeated voiding of urine in clothes, and the criteria is at least twice per week for 3 months continuously. And diagnosis is made only after the age of 5 years. So before that, we don't consider that to be a diagnosis. And it should not be caused by a medical condition. So we first get them assessed by a pediatrician or a urologist. If everything is fine inside the urinary bladder and the conducting system of the kidneys, then we say that the child has enuresis. It is more common in boys. All we tell them is behavioral kind of techniques, no fluid after 7 in the evening, reduce your fluid intake in the evening time, okay, put an alarm. We tell them to get up in the middle of the night, go and pass urine, come back. We can give them the responsibility just in case they void in bed. We tell them to take the clothes and, at least soak them in powder and water to give them the sense of responsibility that tomorrow if I wet my bed again, I'll have to do that. So they're more cautious about getting up with the alarm. Exactly. Yes, yes. No, so that's why we diagnose it after 5 years only. Yeah. It can. Many of them actually come to us when they are adults. So they have to go to hostels or something. At that time, the parents will bring them to us. That, now he is moving away from home. He'll have this problem in the hostel when he has to share the room with another person. What to do? So it continues. So we tell the parents to give them stars the day the child has not passed urine in bed. Accumulate those stars. At the end of about, say, 10 or 20 stars, we tell the parents to reward the child with, whatever the child likes. Yeah, some gift. So it becomes like a reward system for the child. Next slide, please. So the assessment, this is a very, very normal, it's a very easily employable tool, I must say. It's available online. If you all can go through it, there's a teacher's version to strengths and difficulties questionnaire. So we have a parent version, we have a clinician version, the child version, and we have a teacher version to it. So when you go through the questions in this questionnaire, you come to know where exactly, the problem of the child is lying. It's got a pre-assessment and a post-assessment. So pre-assessment is at the time when the child is being diagnosed, and after the child has undergone treatment or therapy or, medications or whatever, after that, what happens to them. Ma'am, anywhere, you just type it online, you'll see it right now itself, on Google itself. Okay, so it's freely available online. Next slide, please. So what are the interventions? These are very, very simple interventions that I'm going to talk about. We mental health professionals, we do something more, but I know it's not possible in the school setup. Next slide, please. So cognitive behavior therapy, that's CBT, that's very commonly employed at least in, the pre-adolescence and the adolescent age group, because that's the most favored thing. Now, there are two components to it. There's the cognitive component and there's the behavior component. The cognitive component is like, trying to, modify the thought process itself. So if I'm scolded in class, the child may land up thinking that I'm useless because the teacher scolded me, right? The teacher would have scolded the entire class, but this child will come back home crying that, the teacher scolded. So when you discover and you find out and you dig into details, it's like, the teacher collectively scolded the classroom, but this child has come with this negative thought that, I am useless and that is why the teacher scolded me. So the cognitive component deals with that particular, the thinking process of the child, okay? The behavior component is, which is more easily modifiable on the surface, how we deal with their behaviors on a day-to-day basis, okay? So that is what I will be stressing on today. The cognitive component is requires a little more of rigorous training. I'll not be talking too much about it. So what we say is that the cognitive behavior therapy, why we think, why we act, because there is some interpretation of an event, okay? So an event occurs, I interpret it in a different manner, and that is how I'm reacting or, how I'm behaving. So we need to change that interpretation of the events. Next slide, please. So this behavior therapy foundation, it deals with the fact that behavior is not seen in isolation. If the child is shouting or the child is getting angry in the classroom, we should not say that, okay, the child is an angry person. Okay, we need to deal with it with strictness. There's something behind it, right? Why should the child be behaving that way? So there are events leading up. So there's A, B, and C. There's antecedents, B is behavior, and C is consequences. Okay. So antecedent is, okay, someone called him that, you're a fool or you're an idiot or whatever. Okay. So that was the antecedent. The behavior was he went and slapped the child. Okay. The consequences were examined because, the child took it to the class teacher took it to the principal, parents were called, and all one big problem occurred. Okay. So the antecedent was this child causing, distress to the primary child. Okay. He called him a fool. Why was this fool thing so badly embedded in this child's mind that, he had to slap the other child? Or what was it his reaction that, he can't control the reaction that, he reacts very abruptly to other children. So you need to find out why that behavior occurred. Okay, because everyone will not respond in a similar manner, right? So why that behavior occurred is something that we need to find out instead of just asking that, who told you to slap him? You should have come to me and, why did you slap him? just find out, what happened before that. So what ran in your mind? If you just ask the child that, what was running in your mind when he called you a fool? Okay, you'll start getting answers to it. So find out what happened between the antecedent and the behavior. That's very important for us. So there's a functional analysis or assessment which is done based on this ABC. And then we find out which behaviors need to be modified and how the behavior can be modified. So there are a few techniques in which, you can increase their behavior by reinforcing the behavior. Token economy is one of them. That is reinforcing the target behavior with tokens that can be traded for reinforcers. So what we do is we tell them that, if you get, if you do your homework properly for these next 10 days, I'll probably give you, 1/2 an hour extra class of library or physical education or whatever. Okay, so the child does it and then, you send him, you stick to your word. Okay, you cannot come back from your word then. So that's like a token economy in which he gets a token every day. Okay, so every day he's getting 1 star or a token, and that is calculated, and then at the end of 10th day, he's given that 1/2 an hour extra of his favorite, whatever he wants to do. Then there's differential reinforcement of other behavior, in which what we do is we reinforce the appropriate behavior. So whatever good that he's doing, we reinforce while ignoring totally the inappropriate behaviors. So if the child is not or talking excessively in the classroom, we ignore it for a while. But what happens is that when we say ignore, most of us as adults will either make faces or we'll stare at them and we think it is ignoring. That also is not ignoring. Ignoring means as if that behavior is not occurring at all. So we don't talk about that behavior at all. If it is a small behavior, if it can be ignored, do that with, with the differential reinforcement. But if it is something which is big, it needs to be addressed, then token economy would be a better way of dealing with things. Then shaping. So what we do is reinforce the gradual approximations of a behaviors, like a hyperactive child who cannot sit for that 40 minutes class. So you say that, 10 minutes if you sit, okay, you get a star from me, right? The next week probably extended to 15, the next week probably to 20. So slowly, you're shaping the child's behavior into what ultimately you want from the child. Next slide, please. Punishment, I'm afraid to take this name in front of a teacher gang. I know how with such a lot of negative connotation it is received these days, but we call it that. So how do we reduce the behaviors, the unwanted behaviors of a child? There could be overcorrection, in which there are series of retribution steps that are related to inappropriate behavior. For example, the child has, purposefully dropped the paint in the class. Okay, because he was angry with another child and he's dropped the paint there. So ask him to clean that area, plus ask him to clean one more area. So you go overboard in the correction. So at least the next time when he does it, he knows that, if I'm going to do a behavior like this, not alone this, I had to do something extra as well. So that is known as overcorrection. Always, when we are applying all these techniques, never be harsh with the child. Okay, so don't show the anger on the face. Don't keep telling him like one elastic, you did this yesterday also, you did this today also, you're doing it again and again and again. So when we keep pulling it like an elastic, the child loses interest in whatever you're doing with him. Okay, so just tell once, see, I had spoken to you earlier, if you're doing something wrong, I will do something from my side to reduce that wrong. Again, don't say that you're being bad. Okay, so don't term the child as bad, term the behavior as bad. So this bad behavior is not encouraged and I will do something about it to reduce the behavior. And then start off with all these modifications. So the child... Yes. Of the class.
Everybody, what I have observed is that there's a child like that who acts. For anything, you just tell, yeah, what is chill? The child starts laughing. Like this. So why not
2 times we ignore. Then we call her separate, but she doesn't have this face, eye contact or all those things. And the parents have taken her also for therapy and all that. But that continues. Only thing is now she's showing some interest in writing or takes out her book. There are slight changes. But now what happens is when we ignore that laughing, it has become a general thing like in the class. Others also start doing that.
Okay. So probably you can mention it that, laughing is not allowed in the class. Okay. And you shouldn't say that, she is allowed to laugh because she has a special this thing, but say that, I'm giving some more time for her to improve.
Yeah.
Okay. So that the others know that it is a no for them, but it is acceptable to a level for this child. I think you can use that for the other children. Yeah. So the other is response cost. So if you've given a token or a star to the child, and if the child does some kind of an unwanted behavior, take away the star. Okay, so 10 stars he was going to accumulate. He had come on the 9th one, and after the 10th one, he was going to get half an hour of free period. But he's done again something wrong. Take away that 9th one. Again, from 8, he has to start the 9th, and the 10th, he has to accumulate again. Okay, so that is like a response cost for the child. Next slide, please. So the other way is timeout. When the child is like really misbehaving or inappropriate, okay, you say that, okay, I'll make you sit in one part of the classroom, okay, without anything. So, the child should not have any books, nothing around the child. Okay, he should be timed out in such a place. So, kept there only, but not allowed to interact with anything or anyone at that particular time. Most of the homes, what mothers used to do earlier was that, I keep the child in the washroom. No, washroom corner is also okay, at least. Washroom, so washroom, the child will happily open taps and he'll be playing with the water. So we don't want any sources of entertainment for the child at the time when we are timing them out, okay? Yes, so out of the class, no, you keep them under your supervision. Or put them right next to your desk, in front, a chair facing you. I mean, that is the best position, I think, for a teacher. So he cannot see the rest of the class, so he has to face you. And let them do. You have to control them. Okay. Then there is a thing which is known as extinction of to decrease the behavior. Removing the previously available reinforcements for an. So what we do is like, the child keeps getting, some kind of behavior, and we keep, reinforcing it with some kind of a token or whatever. We decrease the reinforcement for an inappropriate behavior. So we don't give it to them, obviously. So thereby, what happens is that slowly, I'm not getting this turn. Okay, I had to go out of class and collect all the notebooks, and I would have had a jolly good time. So I'm not being able to go because I was, not behaving appropriately. So slowly, there should be extinction of that kind of a behavior. But all these things take a lot of time. You have to be patient. This is behavior of a child which is developed over the years. If you think that within a month or two it's going to come down, it will not come down. Okay, you may struggle with the child till the end of your, annual year, but you would have definitely, caused some kind of a dent in that behavior. So whatever you can do from your side, please do it. Okay, so that it becomes easier for the next class teacher to handle it. Next slide. It's okay. You say that, Happy. Yes. What are the behavioral experiments that we can do with, these children? The first one is experiencing the panic symptoms. Like I told you, the panic itself is a very, very bad feeling for them. They feel that, they're going to die or they're just going to disappear from the earth the next moment. So once you know that it has nothing to do with a medical disorder, just tell them to, just calm down, sit in one place and experience the panic symptom to make them go through the anxiety and then lower it down on their own. By that time, they'll get used to it that, I'm confident enough to face this. So the next time they're not so scared, the panic attack is going to come. And slowly the anxiety will die down. The panic attacks also will come down. The other thing which we can do behavioral experiments with is the social phobia. So we expose the child to social situations gradually. So don't put him in front of the entire school. Start doing it with 4-5 children first. Okay, you have made this experiment, now explain it to these 4-5 children, how you've done it. Okay, or only start with only 2 children first. So slowly and gradually the child starts gaining confidence and then realizes that, it's not such a big deal that, I was struggling with. But do it in a graded, gradual manner. Never expose the child suddenly to the worst possible outcome that he has in mind. Next slide, please. Then there are, other things like breathing techniques for anxiety. There are muscle relaxation techniques for anxiety, mindfulness that you were mentioning, ma'am. So all these things are there for, anxiety disorders. Next slide, please. JPMR is a muscle relaxation technique. Jacobson's progressive muscle relaxation. Next slide, please. So in the exposure techniques, like I said, phobias is one thing that you can expose the child to. OCD is another thing. For example, I told you about that child who used to come back every day, check his desk and go back. So ask him that, once the bell rings, you've picked up everything, you're out of the class, you're not allowed to come back and check. Okay, so exposing him to that situation, but not letting him do the compulsion at that point of time. He does get irritation. So initially the irritation will rise. So you have to explain this phenomena that initially the anxiety will rise. Okay, the entire evening you may be, still thinking that have I left behind something, have I left behind something, but that is the way to come out of it. Okay, so let it be. We will expose you to that situation every day. Okay, and then we'll see over time. You can only ask the child to grade the anxiety levels. Over time, you'll see that, the anxiety levels are coming down slowly. So that itself will give the child a lot of feedback about his behavior.
So what the child is fearful about, he has to face it.
Yes.
You have to tell him or her to face it.
Yes, but do it in a graded manner, whatever it is.
Such problems can it come all of a sudden at a certain age?
Usually it can, but there must be something underlying before.
Because in my class, in class 10, there's a child who was very normal till class 10. Now she's scared of coming to group. Her kids usually see a period that the entire school is together or during the assembly. When there's a crowd, she starts crying that on Saturday or Friday, whenever she starts crying. She's in class 10.
I think you should take
I don't know
her.
why I have that fear. Ma'am, I don't want to come into school. But when there is a
Big crowd.
crowd.
Yes.
Now in
Ma'am, you can ask her if there is a reason behind it. If there's no reason,
But I don't know myself.
So if there is no reason, you start exposing her. So you tell her to be near the door. Usually these people are afraid that, if some calamity occurs, what will happen? Will I be able to leave the room? So usually, you will get a history also from such children that, they're afraid to sit in a movie theater, in a big mall, crowded, okay, in elevators. So they feel very scared in crowded, claustrophobia kind of a thing, yes. So you can start exposing them to the situation slowly, okay? And put her near the door along with her own friends first. And then slowly keep moving her a little inside. So that, we'll perform this experiment so that you overcome the anxiety. Initially, you are going to feel anxious, but over time, you will only realize that the anxiety is coming down. Ask her to grade her anxiety. Okay. So OCD also, you can do these exposure techniques in cleaning, washing and all. So once washed, don't go and again wash your hands. Or cleaning, once cleaned, don't go and again clean yourself again and again. For OCD, both medications and therapy works out. But if it is a mild thing, which we can tackle only with therapy, we do only therapy. Also with phobias, again, if it is not disturbing the person so much, we don't usually start on medicines. So it's only the exposure therapy that can help them out. The only childhood disorder that does wonderfully well with medicines is the hyperactivity disorders. So, we really get a very, very good response. Many parents are very apprehensive of starting medicines, but we see a wonderful response. And that's like one medicine that has shown definite efficacy over time in children is this hyperactivity disorder, ADHD. Okay. So why cesarean occurred is the question. So was there some distress in the fetus? That could have caused the ADHD. So you should ask why the cesarean took place. So before that, what was the condition that the doctor said that for this reason we need to operate? No. Yes, yes. So usually, earlier on, we used to also advise, these hyperactive children to go on drug holidays. But now that concept is going away slowly. But during holidays time, we used to allow them to be hyperactive, and when the school would restart. But now, they realize that, everywhere they're learning something. So if they can focus better, they can learn better. Next slide. There are many changes which are expected from family also. So, get the family involved in all these cases. Never try to do therapy with the child alone. Make it known to the family. Because like I said, many times the pathology lies in the family. So what will you do, dealing with only secondary part of it? You have to deal with the primary part and make them more sensitized. Sometimes you have to give them home-based tasks to do. So that obviously the parents have to follow up and we have to get back the review of the task. Next slide. So these were all about the childhood disorders, the few that I can tell you all about in this short span. But there are many things to do with lessons of life that I think all our children should learn. We see these days, many children who do academically exceedingly well. Okay, they'll reach IITs, okay, all the possible institutes they would have finished. But in life, as a person, you'll feel that, they're not achieving that kind of success as they should have achieved because of their academic background. So where is it that they are lacking? I just gave you an example of that social phobia case, the child who was afraid to go in front of people and interact. So is there something to do with, the way you present yourself, the way you think, or the way you act? Your behaviors also play a big role in life. Also, teaching them resilience earlier part of life prevents a lot of mental disorders later on, okay, in adulthood as well. So if it started early, it would be really useful. It's like a preventive strategy that at a school level you all can take up to prevent psychiatric disorders later on in life. Next slide, please. Yeah. So intelligence quotient versus emotional quotient. I mean, I think all of you must be exposed to this terminology of emotional quotient now. Why? Because, we know that toppers are not always the most popular kids in class and they're not always top in their professional ladder also. Why is it so? Because EQ plays a big role. What is EQ or emotional quotient? It is the ability to understand and manage your emotions as well as recognize and influence the emotions of others around you. So someone else is making you get angry, you're managing your emotions inside your head. You're not reacting in that manner, right? Also, trying to modify the other person's emotion, that is reducing his anger with your behavior. What a perfect world. Yeah. So this is what, we try to achieve with high EQ. There are 5 categories of emotional intelligence. Next slide, please. The first is self-awareness. That is ability to recognize and understand one's own emotions. Okay. I got angry. Why did you get angry? What was your first emotion that made you get angry? Okay. So recognizing and realizing one's own emotions. What am I feeling right now? So you can modify your behavior accordingly. Recognize the impact of those emotions on others around you. So with this emotion, if I go out, if I interact with other people, how will it be for others? How will they perceive me? How will I be in the eyes of other people if I go out with this emotion and I show a certain behavior? Next slide, please. Self-regulation. That is ability to manage one's own negative emotions. Okay, so I'm angry, I'm feeling upset today. I was scolded by my father, early in the morning without any fault of mine. Okay, I'm feeling very upset and I come to school with that negative emotion. Okay, so how to manage it? Okay, that was one part of life. This is another. Okay, I'm in the school right now. I'm again with my friends. Okay, I can talk to someone about my negative emotions. I can, handle it by myself. Adapt well to changes in circumstances. Oh, it's very hot in this hall. I can't sit for a long time. No fans are working today. What to do? I'm so irritable. I can't focus on studies at all. Okay. So adapting to that also. Okay, it's just a part and parcel. Everyone else is sitting around me. Okay. I can sit for a while. Big deal in that. Let me start, focusing on something else so that I can adapt to the situation better. So self-regulation also helps in managing a lot of conflict. So if you can manage whatever is running inside you, you will not react in a particular manner. You will not react with anger or immaturity with the other person. And that will help you in managing a conflicting kind of a situation. it is such people are more likely to take up responsibilities later on. So these are the guys who become big CEOs and CAOs and all that in big companies, who have a fair amount of self-regulation on themselves. Next slide, please. The other thing is motivation, ability to self-motivate. Now see, we in this competitive world, we all know, how one mark in these competitive exams is holding good, and children are already scared about it. They are there, I hear this from many of my patients who come and tell me that, ma'am, I've been told class 10 or class 12 is a turning point. I can't study, what to do. The turning point phrase itself is a big thing for these children, okay? So I tell them that, how will it turn your life? Say, who asks me how much I scored in 10th or 12th, or who asks anyone else around? So what is so turning about it? It's basically, they're scared of the competition that they are exposed to these days. And I don't blame them for it. I mean, obviously, when each mark is carrying, so much of importance in their lives. So especially for the competitive exams, but explain it to them that that can be achieved only if you compare yourself internally, right? So make the comparisons internally within you, so that, okay, last time I did this much, I need to do better than what I did last time. When the comparisons are within you, the anxiety is less, because you have more control over things, more control over your actions, rather than trying to compare yourself with something which is outside you. Someone outside who's studying more is not in your control. But within you, I can study this much, I can perform better, is all within yourself. So focus on achieving internal gratification rather than external praise or reward. As teachers, probably, focusing less on their marks, trying to, praise good behaviors of a child. I think that would go a long way in any classroom, rather than, just focusing only on the child's marks and comparing it. I know no one does it these days, but still, I mean, a few teachers do. So these individuals have a tendency to be more committed and goal-focused, okay? People who have internal motivation. So, giving them some kind of a task and making them achieve it is definitely easier if they have motivation inside. Next slide, please. Empathy, what we were talking about with the conduct disorders and opposition defiant disorders. So ability to recognize and understand how others are feeling, okay, and then reacting likewise, okay? So a child has come to you and he's already looking, very frail. He couldn't eat his tiffin. And then, you're scolding him about something else that he's done. First ask him, have you eaten something? Okay, then start the conversation. Probably the child will feel more comfortable in talking to you, rather than starting with the sentence that, why did you have to scold, or why did you have to hit the other guy? Consider those feelings before responding in any social situation, like I said. Responding thoughtfully and kindly. Kindly is the key word, okay? How I would want another person to respond to me. So it's basically, putting myself in other shoes and then looking at the situation. It helps one understand the dynamics that influence relationships, right? So it goes a long way in interpersonal relationships. It could be anywhere, okay? At work, in the family, in your profession, anywhere. Next slide. Social skills is another category of, EQ, in which we teach them ability to manage others' emotions and using this to build rapport and connect with people, okay? So that, the other person is angry or upset about something. And if you think that, okay, you have made a fault, going and saying, I'm sorry about the way I reacted. I probably shouldn't have, but I have my point of view. Can I put it across to you? Okay, so putting it in that manner, I think will go down well with the other person, rather than saying that, what do you think? Why did you talk to me that way? There are ways of putting the same thing in, employ a better situation at that time, to bring down any kind of conflict. Active listening. Okay, so just listening is not enough, actively asking questions. Okay, so then what? Nodding your head, showing non-verbal, signs of that you're interested in what the other person is talking about is, another form of a part of social skills. Verbal and non-verbal communication both. It also helps in forming and maintaining relationships that, I think all of us know, and that all of us know so well today, which is so required in today's world. It's no longer, only academics. A person has to live in the society. They have to form interpersonal relations with other people. They better have good social skills. Next slide, please. So how do we improve the IQ? We teach them how to notice your own response to others, the tone, body language, facial expressions, and how others respond to you. So probably you can tell them, even the mirror technique, stand in front of a mirror. If the person talks to you this way, how will you respond? Observe all your facial expressions, see how you're looking to yourself, and then start responding likewise. Or if you like a certain person's response, see how, the person puts it across to you. Use those words, use those ways in how, to bring forth your response to the other person. That would help in your social interaction with others. Positive language, like communicating using the right words and the right method. So, like we teach them that, anger is not a bad emotion. No emotion is bad. Okay. We all have those navrasas in our life. Okay. And they exist within us. So all of us get angry. We all feel sad. We all feel happy. All of us have it. It's the way we express it out makes, the difference. So, talk out to them that, if I were to say that, I'm upset with you and that is what is making me angry, wouldn't this be a better response rather than, what do you think of yourself? Why did you have to do such a thing? So there are two responses for the same thing, but, the first one definitely sounds better. Keep going. Realize that all of us have temporary setbacks. Okay. One failure in life is not equivalent to your entire life getting failed. So there will be temporary setbacks in everyone's lives. Okay, there will be ups and downs in everyone's life. I joke about it to many of my patients. I said, whoever comes and tells me that I have no problem in this world has to be a mentally retarded person. Right? So problems will come in everyone's lives. Okay, let us learn how to deal with it. Okay, you're facing a temporary setback. Take your time. Okay, rise then. Okay, slowly start finding out solutions to the problem rather than just sitting and brooding about the fact that I have this or I have this problem. Show compassion. Okay, so practice kindness, empathy. You start with, daily a gratitude thing that, okay, I have, these 3 good things today happened to me in my life. You feel gratitude for yourself. Then you try to become kind to others. Okay, so how did all that happen in my life? It is because of this and this person. So shouldn't I be practicing some amount of kindness and empathy towards other people? Next slide, please. So how to achieve, mental well-being? Creating a positive classroom environment, okay, having more of cooperation rather than competition. Make them help each other out, okay. Say that, you're good at maths, why don't you help out someone, in your classroom. I know these days children will just come around and tell you that, ma'am, I don't have time. So, you find out only one sum, okay, just help him out with this one sum. Let's see if he can get help. So start taking small, short things for help from the other child. Fostering self-esteem and agency, having realistic expectations out of life. Okay, the parents will tell, I see that person, my relative got this much. Okay, you also should be getting. So you say that, you try your level best, whatever is possible. See, you're achieving this much now. Next, how much can you achieve with your own efforts? Compare the child with his own marks rather than anyone else's. Praise for good behavior. That praise actually goes a long way in building a lot of social skills in children rather than only praising them for their academic excellence in their work. Focus on their strengths, okay, rather than weaknesses. So keep inculcating that, okay, this is very good. Go ahead, okay. Slowly, they'll realize that when they realize that I'm good at this, I can manage the other thing also well. Life skills education, I think all of you are doing it in schools these days. Good communication, social, cognitive, and emotional skills. I'll just tell you about it briefly. Anti-bullying programs, I think, are there in all the campuses these days. Sensitizing students about mental health issues is very important. Like I said, when you start young, it goes a long way. So removing stigma about mental health issues, I think starting at this age will really, we'll get a next generation of people who's not saying that mental health is a taboo. Okay. So, and I'm seeing, you'll be surprised. There was this 12-year-old child who found out by himself that, he has depression. He got his mother, he searched me on the internet and he got his mother to come and meet me. saying that, ma'am, I have all these, he took out his phone and he showed me the symptoms and he said that I have all these symptoms in me and I wanted to seek psychiatric help. So children have become that smart these days. So I think it's a good sign in a way that, that taboo of mental illness is going away from them. Also, digital literacy should be provided to all children before they are handed over mobile phones or laptops in their hand. There'll be a lot of questions about it, I know, but this requires a complete one-day workshop on its own. So I won't go into it right now. Next slide, please. Academic difficulties, if you're seeing that the child has either low IQ or a learning disability, obviously, you have to refer them for assessment, extra hours after class. Small group teaching works out well for them. Psychoeducation of parents is very essential. They call them lazy. They'll say he doesn't want to work. Obviously, the child cannot do something over there. He's losing interest over there. So, education of the child, of the parents is of utmost importance in these cases. Next slide, please. Other emotional problems like increasing awareness about mental health among students through talks, having discussions inside your classroom, through movies, you can, impart that knowledge. Discuss the problem with the student alone. Okay, so don't try to discuss it in front of the whole class. The classmates will have their own interpretation. This child, to, show that I was not wrong, he will try to defend by either lying or, getting some other problem into the way. So talk to the child alone. Keep it as confidential as possible. Okay. Many a times, teachers talk among themselves. So the other teacher comes to know and, he comes in the next class and starts discussing about it in front of the children, and this child feels very ashamed. So keep it as confidential. Even if you have to discuss it with your peer group, say that, don't mention it when you go to the classroom. Problem solving should be taught to these children. Check for death wish and suicidal ideations in these children when they're looking low, dull. If you see some kind of marks of, attempt, immediately speak to the parents and seek mental health professional help. Next slide, please. In behavioral problems, we have a lot of desirable behaviors in each child. We have a lot of undesirable behaviors in each child. No child is purely desirable or purely undesirable behaviors. So increase their desirable behaviors with, reinforces like verbal praise or stars or whatever you can do. And undesirable behaviors, I have talked about how to deal with it. Also discuss how to improve the child's behavior and not alone talk about his undesired behavior. So if the child is, being very aggressive in class, sit with him and say that, do you like being like that? Obviously the child will say no. Okay, but he said this to me and that is why. Okay, so even if he says this, how do we go about it so that we don't react in this manner? Okay, so talk about the desired behaviors to the child rather than only the undesired behaviors. Be more solution focused rather than problem focused. Okay, it will help all these children, in finding solutions in their day-to-day lives as well. Next slide, please. So in bullying, we see, I'll just take 5 more minutes. I'm just coming to the end. Is it okay? Yeah. So bullying, we see boys usually hitting and beating, and girls are bullying through words or through social media, putting posts and everything like that. It could be a very, very common cause of school refusal. Many children who are being bullied, they don't want to attend school the next day or, for days together. There should be zero tolerance policy in most schools, and it should be, clearly told to the children time and again that we have zero tolerance policy. So in assemblies, it should be announced over and over again whether any child is bullied or not. Okay, so it should become like a practice. Okay, so that the child knows that, if I do something, this is wrong, this is wrong. It's like going on ringing in the back of his mind. Playgrounds and other common areas should be well supervised. And there should be a system to report bullying anonymously also. The child may be scared of, coming and talking to a teacher. So there should be a drop box in which they can just put the complaint, whatever they have. The bully should be talked to in private. Okay, we don't know whether the complaint is right or wrong. So humiliating the other child is also not right, on our part. Talk to the child separately without humiliating him again. And the bully should be asked how to modify his behavior. Like I said, be more solution focused rather than going on asking why, what. Next slide. So school refusal is another problem that we often encounter. It could be a result of academic issues, emotional disorders, a lot of behavioral problems, bullying, issues outside the school. When they step out of school, there are many senior children or, men who stand. I remember one child who didn't want to go to school because he was told by these boys standing outside that go and buy me cigarettes. So the child, he wouldn't want to go to school for that purpose. So a lot of activity that goes on at the time when the bell rings and the children are leaving the school. And there could be, problems in the family as well. Again, we should not be judgmental that, you're being lazy or you're just acting smart and not coming to school. Listen to the child's perspective and maintain complete confidentiality and work on it. Next slide. Relationships and sexuality is becoming a big problem these days, especially in life wherein we are exposed so much to social media. Day in and day out, we come across all these cases. So sexual curiosity is something which is normal at an adolescent age. It should not be misunderstood. So if the child is going and, hunting or searching for something online, sit with him and say that, do you want to clarify something? I'm there to clarify it for you. Because there are many things on the net that you find which may be inappropriate or which may not be the right thing. So say that, there are these people who can talk to you. If you're uncomfortable in talking to me, I can, get someone else arranged to talk to you, get a person who's not known to the child, okay, and then get it done. So sexual curiosity is normal, but it is generally misunderstood. There's a lot of guilt in the child that is associated with their curiosity. So they think that, if I want to know, I'm wrong, because again, the society has told that, it is wrong to talk about sexual matters at home or in school or anywhere else. There's this new problem with gender identity, gender role, and sexual orientation, with the third gender being talked about. These are all fluid entities when a child is an adolescent. So if even the child comes to you, you say that, there's nothing right or wrong about it. You can have your own sexual orientation, it's fine. But just wait for it to crystallize, because adolescence again is an age wherein it is not yet crystallized properly. You don't know where your sexual orientation lies right now. Don't be judgmental about the child. Also, sexual abuse is a big problem at this age, and people don't talk about it, and for years together, these children, they suffer. Romantic relationships, probably we need to handle it in a better manner by way of sex education. Teaching them safe sexual practices, talking about consent in any relationship, and boundaries in any intimate relationships, okay? Also talk to them about responsible decision making, that, if you decide right now, what are the consequences of this problem, okay? So then the child will be more forthcoming. They'll probably realize where things are not right or right, and they'll make their own decisions. Menstrual hygiene for girls, that I know is being taken up in schools these days. And do not have moral judgments about children just because of any of these factors. Be supportive. Next slide. In life skills training, we talk about the adaptive and positive behaviors that help us deal effectively with challenges of daily life. We teach them all social, cognitive, emotional skills. Try to work in small groups, because, bigger classrooms, many children, they don't voice their concerns, they don't ask their doubts because they're shy to ask about all these things. They think that they'll be laughed at. And there should be a lot of brainstorming. So give them a problem and ask them all to brainstorm and find, solutions to it. Discuss about those probable solutions that they have given, and then come to the best solution possible over there. You can do it through role play also, skills training. So, you can become the aggressor, and, you can make the other child the person who's being bullied, and then you can do the role play. A lot of games, debates, video clips can be, used to teach life skills training. There could be home assignments. Next slide, please. We have, in social skills, we have to teach them effective communication, importance of interpersonal relationships and how to go about it, empathy and self-awareness that I spoke of in the emotional quotient. Next slide. In cognitive skills, problem solving, like I said, give them a problem, let them all sit and solve it, discuss all the solutions to the problem, and then find out, which is the best probable solution after discussing the consequences of those solutions. Creative thinking, it could not alone be in the art form. It could also be, giving them problems and then letting them, think creatively about how the problem can be tackled. Next slide, please. Emotional skills, coping with stress and coping with emotions, like I just talked about. Next slide. So an example just of coping with an emotion, we take, we introduce the group and we tell them that, I'll put across a situation like this, wherein a child was eating something, another child came, rushed, and, he pushed the fruit or the cake out of the other child's hand because he wanted to eat it. So this child also couldn't get it and it fell down. The second child also couldn't get it. Okay. How will you deal with this situation? How should that owner of the tiffin deal with the situation? Okay. And how should this child, go and talk to the other child? So you can divide both the classes. So one can be the tiffin owner, the other can be, the child who has, spoiled the tiffin. And you can introduce the ideas to them and ask them their responses. So if the child says that, he should shout at him, so what are the consequences of it? Okay. So the consequences could be, it could go to the teacher. This child can, probably hold animosity later. Okay. These two are friends, but now, they may have some kind of a tussle. So how can it be handled better? So discuss consequences of each solution with the children to find out a better response and then discuss about the best response possible. Next slide, please. So in conclusion, I would like to say that childhood disorders are very common, but often not diagnosed timely due to various reasons. Okay. We think, okay, child, probably he'll improve on his own, or parents are apprehensive to, get them to mental health professionals, or what will happen if my child is going to a psychiatrist, or the teachers are apprehensive in bringing it to notice of the parents because, they think that, how will the parents take it? There are many reasons. Teachers, with the help of mental health professionals, can help these children get timely help. Few psychological issues can be addressed by increasing resilience in the children itself, okay? Improving their life skills, bettering their resilience, obviously, will address the psychological issues. It will also, I said, have a preventive aspect to later on developing mental health disorders. Since we know that academics alone does not help us survive in real life situations, is it not imperative for the society as such to impart life skills to these children at this stage itself? Thank you.
Madam, very informative session, and we will take up questions.
Sure.
I think that every school we should invite psychiatrist at least 1 or 2 months in between, okay, so that they can
I'll tell you a small anecdote. I got a mail from my child's school and they were asking for, who's ready to take workshops on digital education and all that. My child told me, Mom, you are not coming to my school. So probably, not by inviting the parent also. So I didn't send a mail back.
Okay, we have the participants here, but they can interact with you personally also.
Yeah.
We have some questions from online.
Sure.
We'll address that first.
Ma'am, there is a question like, are there any technological tools that can assist someone with learning disabilities?
So it's not technology. They have clinical psychologists are actually the persons who should be assessing. We as psychiatrists don't assess. They have proper tools, okay, which have been designed for the Indian population, which assess the child for all these disabilities. They get a certification from the clinical psychologist. And also, like I said, they have certain privileges of, leaving out a language or, the paper difficulty level comes down for these children, at least in Karnataka that I'm aware of. I don't know about the other states. I can talk about Karnataka. Yes.
The next question is, are there any specific intervention or strategies and programs to promote mental wellness and prevent mental health disorders among learners?
Among learners?
Learners.
Okay, so among school-going children, that's one. So, like I said, now you all have started with life skills program, which I am very happy with the CBSE, at least, in that way that they have started with it. I think we should focus on training the trainers first, right? So when we focus on training the trainers, obviously, we'll have a bigger set of people who are trying to impart that knowledge to children. Obviously, none of the teachers have been, imparted with that knowledge earlier on. But how to deal with that training of life skills itself is a big thing. It has been introduced in schools, which, I'm happy about. But I think imparting training to teachers is very important today for this goal.
what are the resources we have to procure that school can create a more supportive and inclusive environment for learners with disorders?
So one is, having special educators. Okay, so having special educators, obviously, they cannot take up every child, but they telling the teachers itself, how to deal with these kind of children will go a long way. And just one special educator may not be sufficient for each school. I think when you have thousands of children and learning disability being so common, I think you need more special educators. You may require a little bit of extra time with these children post school hours if their parents are ready to give in that kind of an input. Okay. These are the resources that you can develop at a school level. Besides that, whatever the government is doing, I think that is also should be, informed to the parents that, if they have this certificate of learning disability, they have certain privileges in the exam, and at least the child will not be, detained because of this particular disability.
The next question is, what is the most effective strategy to deal with oppositional defiant behavior in children?
There is no one strategy that I can say, but behavioral training of the child, okay, teaching them anger management skills, how to, assess their emotions and then react, okay, would be helpful in these oppositional defiant disorders. One thing is there that it takes a very long time to deal with these patients. It's not easy. We should be persistent, and we should take it up each time. So one time the child does some mistake, we deal with it in the manner in which we have talked to the child. The next time he does it, we try to ignore, the child. The child thinks that, he can manipulate you. So be persistent, be insistent. Okay, every time the child behaves in that manner, give him the same kind of token withdrawal or whatever that you have, talked to the child or dealt with the child, so that the child understands that this behavior is a no-no. Start dealing with the child with one behavior at a time. Don't try to deal with all the behaviors possible. Okay, then the child will also not be able to follow, and you will also fail in the effort. So start with, probably a behavior that is either, most problematic and causing a lot of problem, which is an absolute no-no in the school level. Or you can even start with dealing with the problem, which is a small problem, so that, the child thinks that, yes, I have gained mastery over one problem. Let me, deal with the second one then. So deal with one behavior at a time.
How to deal with massive indiscipline activities in the school?
It is all to do again with, how to deal with this. Be persistent with your approach. Don't give in to the child just because he's telling you a story, or, you feel sorry for the child once in a way. We all do feel sorry for these children, but be insistent, be persistent. And like I said, how to deal with the oppositional defiant disorder, the same way you have to deal with extreme amount of indiscipline with these children.
I think online questions are over now. We will have anybody from here. You will.
Yeah. I would always talk about inclusive education with special educators.
Actually, in every class, one or two we will be having.
Yeah.
Even though they are, I'm from Navodaya school, they are having entrance examination. They are qualifying entrance examination and coming.
Yeah.
But still we find that some children are there with clear-cut learning disorders. So how can we make them inclusive? That is a great problem.
So if you don't have special educators, I think you should ask your school to get special education, how to deal with these children.
There is no other go. Because after 1 or 2 years, we are telling the parents to take TC. Otherwise, it is becoming very, very difficult.
No, like I said, the assessment, okay, and if you can provide those privileges to these children. So we have it in Karnataka, right? We have these special privileges for children who have learning disabilities. So they can produce that certificate at the time of admission in class 9 or 10, and the principal has to send it to the board. And,
that half an hour extra, 1 hour extra for exam only they are
they
getting.
have a language exemption also here in Karnataka, if I'm not wrong. Yes, it is there. Yeah. Right. Okay.
One subject.
I think that you'll be able to get more from the educators rather than from that information. I agree.
But are there educators in all your schools? You have
Do you have special educators? All of them? Okay. Okay. Oh, that's great that you have. But all this, when we see it is, we feel it's very useful and it is easy, but not in a long run.
I
It's
agree.
not possible.
I agree.
Because as teachers, we also have the stress of academic, completing our syllabus and all
I
that.
agree.
We can't be persistent at times.
Ma'am, I agree. I also empathize
And so
a lot.
every school, it is compulsory that we have special educators.
It should be, ma'am,
It
that
should
way.
be
I empathize a lot with teachers these days because I see, how we were dealt with as when we were students. We were shouted at, scolded, hit also times, punished also times.
Because in a class of 50, in
Yes.
class 1,
Yes.
there is a special child who can't sit in a place.
Yes.
The class teacher has to run, he bites, he pulls her. At the end of the day, she's exhausted.
Correct.
Like the other children are losing because of just one child. Inclusive education is good, but we should have a special educator or the parent sitting in the class
Yes.
with such
Some
children.
mentor should be there to
Yes.
guide these kind of children. Definitely, I agree with that.
I mean, they can't, rather, not that they don't, they can't concentrate and they run round and they disturb. So we've spoken to the parent and now we said we'll take a shadow teacher.
Yeah.
And the parent volunteered to come in as a shadow teacher and she sits with the child so that she is able to also manage and support the main teacher. Without that, ma'am, as you rightly pointed out, virtually impossible to manage. I agree. Later on, they come out of it. Ma'am, you got to talk to the parent very probably.
like one, we had a house here, was there for 2 months and she left. So we don't have anybody in the class.
I think you should get in touch with the parent, I think.
Childhood, they are addicted to mobile phones. We can prevent when in the earlier stage, but when they are coming to school, they are already they are spoiled. They are not able to concentrate on anything for some extended time. So it's very difficult how to deal with the.
Like I said, I can take a workshop entire day for digital media, but see, how has the child been introduced to the mobile? It's us, by parents. So we only have to take it off. So anything that, it's the same reward mechanism, okay? Basically, if you employ the reward mechanism, the taking away of tokens from a child, so you talk to the child first. Don't impose rules without talking to the child. Even a 6-year-old these days realizes, what is right, what is wrong. They'll have their own opinions about it, but that's okay. So you tell them that, we'll allow you 45 minutes of, mobile watching every day. When do you want to watch? Apart, if you haven't finished, then, you do the homework and then you get it after that. If the child is not giving you the mobile, then you tell him very clearly, again, don't snatch, don't fight, don't become aggressive. Say that, okay, tomorrow you will not get it because you are using it too much today. Initially, when you're trying to impose any such problem, okay, any such solution to a problem, the child will obviously revolt in a manner, whatever is suitable for him. He'll not talk to you or she'll, create tantrums, she'll shout. she'll cry, she'll lock her room, go inside, okay, behave in an odd manner. You have to be, again, consistent and persistent about it. Say that, I think we all have had a talk about it, and we are not going to allow you beyond this. Once the child realizes that the mother or the father is not yielding in, they start following it. So the initial phase is going to be difficult in any kind of behavioral management, ma'am. Whenever we are trying to modify it, there will be resistance from the child, because that was the behavior that, the child has been comfortable with for so many years. When we are going to change it, obviously the child will also find difficulties, no? So it's okay, but stick to the rules.
Ma'am, may I say something?
Yeah. The sleep cycle, 1 second, I'll just let you know. So many a times we insist that, the child should sleep at a particular time. Instead of that, you fix the waking up time. Okay, so the waking up time, once it is fixed, obviously the sleep time will on its own, come back in its regular schedule. So say that, okay, on holidays you're allowed to sleep probably an hour extra, but on other days that, you have to wake up at this time. So once you fix the waking up time, the sleep time will be regularized. Tell them that no social media, no phone, no laptop, no TV beyond a certain point at night time. Okay, no loud music and all when you're trying to sleep off, things like that. So instead of mobile and all, you can read a novel or a book, a storybook or something while you're sleeping off. Because we always say that all this, makes you more excited. The phone browsing or the laptop or the TV, and it pushes back your sleep. So let it be a storybook or something with which, you can comfortably sleep on. Absolutely. Absolutely.
They are coming with addiction only. They are coming with addiction. See, madam, if a kid in their home, see, even for making them, giving some food,
yes,
they are giving cell phones.
Yes, sir.
Even a mother is getting ready to attend a function, giving the cell phone. And fathers also, we people also do. Father also, madam. I am. You see, so they come to school at the age of 5+, and for nowadays I think 11+. So for 10 years they have been with the cell phone. That means to some extent they have been already addicted.
No, in schools I think they are not allowed, right? To carry
in
phones.
the school, okay, madam. All these things what you have said are to be done by
Absolutely.
the parents only.
No,
so
that's
we
what I
need
said. It's
parent education.
It's they who have introduced the child. They have to deal with de-introducing it.
Yes. Thank you.
Excuse me, ma'am.
Okay, so bipolar disorder is a mental health disorder which affects 1% of the total population. It usually starts off in adolescence, like late adolescence, around 18 years of age, and 18 to 30 is the age of onset, and it's an episodic disorder. So usually in children we see it rarely, not that we don't see it at all, we do see it, but rarely. In this they have episodes of depression and mania or hypomania. Now depression I spoke about, in which you have sad mode, lack of interest, you are not, feeling like doing whatever the activities which were making you feel enthusiastic, lack of sleep, no confidence, loss of concentration and all. Mania or hypomania is just the opposite of depression. Okay, so just the opposite, when the patient becomes very cheerful or overtly aggressive, overconfidence is there, he socializes too much, he becomes over-religious, he may go around spending too much of money illogically, okay, very restless, they wake up early in the morning and want to do a lot of tasks together. So that is just the opposite of depression. So these two episodes can occur in a phasic manner, or sometimes, it is, there's an interval wherein the patient is absolutely fine, and then again, they have either an episode of hypomania, mania, or depressive episode. And that is why it's called bipolar. Okay. Now, this has to be treated with medicines. Okay. There is no way that, you can treat these patients by counseling or, psychotherapy works out in a few cases for in the remission phase when they are fine. Okay. But not when the patient is actively manic or hypomanic. At that time, whatever you say will not, hold good for the patient. So we have mood stabilizers. Yes, mania can be very aggressive. There are patients who get into problems with the law. I have had patients who have gone and ordered 4-5 cars, booked 4-5 cars under the episode of mania. They've exhausted all their money from their credit cards. They travel, God knows where all. They get lost. They lose connection with the rest of the family. They come back, days later, or they're caught, or they're, they only tell their identity, and the police gets in touch with the family members over here. They become overtly social at times, sometimes to the level of being disinhibited as well. So socially, they don't look appropriate in front of people. They may get into rash behaviors like driving rashly, getting into accidents, getting into arguments, physical fights, and that's why the law thing and all that. It can get very bad.
Ma'am, there is a question from online. How to deal with the children coming from distorted family who are emotionally and psychologically affected and therefore showing behavioral disorders?
Right. When we deal with children, the first thing I would like to point out is that to form a rapport with a child is very difficult. Okay, so we get patients, whose parents will come to our OPD and they'll say that, ma'am, you treated one child. We thought just one counseling. The teacher said, just go get one counseling done and you will be fine. Okay, one counseling is one structured consultation itself takes us about 45 minutes, and in that time, all we can do is collect history actually from parents and from the child. So the first thing is it takes a long time to establish rapport. The child, how can he be discussing everything with a total stranger? There's so many things that he has kept inside his mind, so it takes very long to establish that confidentiality. Don't be in a hurry. Okay, so go slowly with the child. You just start talking about his interests first, okay, about school or about other neutral topics that interest the child. Then start delving, or the child will also start feeling comfortable with you, and then start talking to you about the problems existing. Find out what the child is facing. Now, what the child is perceiving may not be totally the correct picture. Later on, talk to the parents as well. Okay, find out what the correct picture is. Okay, and then start dealing with the issue one at a time. If you think that the parents are not amicable to any changes in life, then probably take another step and take a mental health professional's help. Or if you have to talk to about the authorities, if the child is being abused, then so be it. I mean, it has to be taken place. So, childhood sexual abuse, first thing we have to report to POCSO.
That is the thing.
Now, but we have to be sure whether what the child has perceived or what the child is saying is the truth. Many a times, they come to us, they tell us a history, and then later on they revert on their own history.
So, no, how can you help the child?
You have to involve the parents in it. Okay, let the parents also speak to the child whether that sexual abuse actually took place or not, or even if the child is perceiving there is something wrong about it, right? So it could be just a bad touch or whatever it is. Okay, and I had this child recently who had come, who was referred to me, and about that particular sexual abuse, everyone had spoken in the school. So now she doesn't want to stay and study in the same school because she says that everyone looks at me in a different manner. And I don't like it any further. So confidentiality is something that, we must keep whenever we are dealing with such sensitive issues. We cannot talk about it to others, especially the classmates who are very, very immature. And, they'll start talking about it. The next stage would be, then dealing with the trauma of the child. For that, if the child is comfortable to talk to you, let them, discuss everything. Otherwise, a lot of, cognitive work goes on with these kind of children who have a lot of guilt attached to the that particular episode, or, they are afraid of facing, many of them say that, I can't let a male come next to me because of my childhood sexual abuse, or a female, vice versa, whatever. And so we have to deal with all those components of sexual abuse one step at a time.
This particular girl was always afraid of males. She's telling that her behavior itself is like that. Very much difficult to handle, ma'am. And from a very poor family also.
I think you can take help from counselors outside, otherwise.
And, ma'am.
Yeah.
We have started it.
I think we need to stop also. The discussion can go at any time, but time restrictions are there. I think someone, madam, 1 minute. Someone will make a vote of thanks. Is anyone come and come?
Good morning, all of you. So sometimes we have to call it as a day. Today I feel this is the day, as there was a lot of information, very interactive, very informative. Actually, many doubts were cleared. We had, we as the teachers, this psychology was a part of the B.Ed only. Later on, we had some orientation. We used to attend the courses like this 1 or 2 days. But now this systematically started. What are the different kinds of the psychological disorders? How to come over, and for what the medication is required, for what the therapy is required, and what is the role of the parents and the teachers and the society as a whole. Really, madam, everyone on behalf of all the parivar who are all here online and offline, I extend thanks to you, wholehearted thanks. Thank you.
Thank you. It was a real pleasure being here. Thanks to RI, in particular Dr. Anil Kumar, for having me here. Thank you.
So we'll break for the tea, and we'll join by 50, okay, 11:50 here. We'll have a small group photo of the participants from here only. After that, we'll start the next session. Thank you. Now, online participants are requested to take a break now. We'll join after 10 minutes. Thank you.
सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632। सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं।
मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। मनोदर्पण पर कॉल लगाए, मनोबल अपना और बढ़ाए। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम।
So we have with us Vasanthi Tyagarajan. Madam is a working group member of Manodarpan. The ministry has constituted a working group. So Madam is one of the expert from South. And we have another group, working group for NCERT also. There are two working groups separately. And along with that, Madam, Kriba Madam is also there, who works at Madam's school. For introducing Madam, let me ask Lahiri to briefly summarize her activities and field.
Thank you, sir. Good morning, all. It is an honor to introduce Dr. Vasanthi Tyagarajan, ma'am. She is the founder, principal, and correspondent of Shishya School, Hosur. With a doctorate in education, ma'am is interested in both teaching as well as training. She has worked with Dr. Howard Gardner on multiple intelligences in Harvard University in 2008. She is also an accredited trainer in differentiated instruction for Harvard University's online program. She is the CBSE Master Trainer for ASL, Classroom Management, Life Skills, Gender Sensitivity, Career Guidance, and many more. Dr. Vasanthi is a member of panel appointed by CBSE for designing of Holistic Progress Card as envisaged by the NEP 2020, and she is also a core member of the CBSE team that has designed the School Quality Assessment and Assurance Manual. She is also an active member of MANODARPAN initiative. She has received national and international awards for her contributions in this field. We welcome you to the workshop, ma'am. And we also have Krupa ma'am with us. She is a counselor in Shishya School, Hosuru, and we welcome you to program, ma'am. Thank you so much.
You would be doing that, right? Yes, I can now say good afternoon because it's just crossed 12. Thank you, first of all, Dr. Anil, for giving me this wonderful opportunity to address a very erudite group of educators as well as trainees in this institution, which is well renowned for bringing out the best teachers in the country. We heard that RIE Mysuru is one of the best for young aspirants. So as rightly pointed out, I think this is a wonderful initiative taken by NCERT as well as by the RIE to host this on promoting mental well-being in the schools. So the theme given to us is about promoting and strengthening well-being in education. What's the way forward? Because a lot of theory could be there. We are looking into what are some simple steps, what are some strategies, what are some ways by which schools could actually begin their well-being steps. We normally have this method of greeting our children in our school. We always use Vande Gurum because we always believe everyone is a guru. The children are also our gurus because we learn so much from our children. So we use the terminology of Vande Gurum. I want to welcome you all. We are now focusing on the objectives. I think we've got to go a little forward. Yes. So today we are trying to look at what is the role of educational institutions and organizations in promoting mental health in school education. We're also going to focus on some strategies, how to integrate mental health into our curriculum. We're looking at some aspects that could promote mental well-being in schools, like positive school environment, maybe early identification of mental health concerns, providing mental health support, and so on. Next slide, please. So I begin with the National Education Policy, which is a buzzword today. And normally all that we do focuses, or it's a fulcrum of all the change that's happening in the country. So a quote from NEP 2020 clearly talks about the 2020 NEP envisions the aim of education will not only be the cognitive development, but also building character and creating a holistic, well-rounded individuals who are equipped with key 21st century skills such as communication, cooperation, teamwork, and resilience. So on the next slide. I found this beautiful poem when I was preparing this presentation, written by a teenager in Texas. And I'm sure there are many such thoughts floating in our country too. When this child says, I'm tired. I'm tired of groping for someone to understand. I'm tired of never finding that one, of always reaching, but never quite attaining. I'm tired of myself. I'm tired. I'm insecure. I'm a hollow being. Tired. Yes, I am tired. Now, these thoughts probably could be the expressions that most of our children must be undergoing, feeling tired about life at a time in their life when they should be productively and healthily going forward to lead the country into the aspirations that we have. Most of our children are exhausted. And it's not a physical exhaustion we're talking about, it is the mental exhaustion that has caused that lacuna, that on the one hand, we are trying to pump in the best of educational strategies, but on the other hand, we have children who are tired, who are so exhausted mentally, they do not have access to support, and probably this could be the reason why many of them are struggling to find a voice in what they need to do. So I thought when we spoke about mindfulness, I think when the previous speaker was talking about it, I spoke about this term called mindfulness meditation. We do this as a very essential part of our classrooms. Like what we do is If I can have a mic, I can even move about this. Okay. And what we do is that we get children before every class begins. Thank you, sir. Thank you. So when we do mindful meditation, the pattern of doing that would be, we understand that children after every 40th minute or 45th minute are moving from one subject to the other as watertight as possible, math into science, into social, into languages, and so on. And we know that every time they move from one to the other, the previous class could have made them feel good at the end of it or made them feel terrible at the end of it. There could be a test which was conducted and they didn't do well in that test. This carries into the next class. So you could have gone in with the best of your plans to execute that 40-minute program. But then what do you find happening there? Children are either distracted or they're looking somewhere, disengaged, because all the time they are with the previous class. There could have been a teacher who used a word with a child, that child is carrying it into the next period. So what we try to do, and it seems to work quite well, is we begin the class simply with a 2-minute, 3-minute mindfulness meditation. And we found it works a lot. I would like us to do, are we all ready to do that right now? Would we like to experience what I do in my class? So I won't take more than 3 minutes of yours, but we will try and do it and we'll see if there's an effect really the way I'm talking about, right? So what is this mindfulness meditation? If you look at what we're putting up there, it is a mental training practice. It teaches you how to slow down your racing thoughts, right? It allows you to let go of the negativity. That's how mindfulness works on us. It slows your body and your mind. So this combines meditation with mindfulness. When I'm mindful, I'm very conscious of what is happening around me and in me also. So it allows us to recognize that I'm not happy now. I'm not comfortable now. Recognizing that is one of the first steps towards coming out of it. Half the time, we do not recognize what is running inside us. We look outside because eyes are very powerful, they take things around them. Very often, we do not look within. So mindfulness is that journey within that helps us to look at, examine our feelings and let us know, where am I right now? Okay. And when I know where I am right now, I can manage with it. And with a bit of meditation and music combined, you find children really feeling good. We've tried it out. I do a lot of training for CBSE. I'll talk about this at the end of it because the previous speaker was talking about master trainers, right? And there are a lot of principals out here. We need a lot of support because I'm a master trainer in most of the subjects, topics rather, and we would like to have many more joining us. We'll just touch on that. If I forget, one of you remind me how to go about it so that you could also enroll into CBSE portal and become a good master trainer. But I've done it in many of my sessions and I found it to be very, very useful. Because this is a mental state that involves being fully focused on the now. So when we do mindfulness, we'll just experience it. You will be focusing on now and not what happened before or what's going to happen in the future. And you can acknowledge, accept your thoughts, your feelings, and your sensations without judgment. It means if I'm feeling angry, I should recognize that it's okay to be angry about something. And then can I come out of it? The first thing is to go within. So let's try out this exercise. So what we'll do is, I use normally this music from the Tibetan healing sounds. You get this on the internet also. And we'll share all of this with you, of course, after the program. But first I want us to look at, I just took 9 emotions, but there are much more in life. Maybe 40, 50 odd emotions are there. But I want us to look at these which are put up on the screen. And I want us to write down in the pad, what is the predominant emotion you're undergoing now? Could you please write it down? Because I can't do a survey and show you your survey right now with a Google form or something, but can we just write down, beyond this also it's fine if you can think of it. How are you feeling right now? Have you written? Then I'll move on. I'm going to play some music. So I'll give you instruction for that. You just sit back and you can close your eyes. I'm going to play some music for you and just relax. So don't hold your hands together, anything, just let go. Sit back, close your eyes. Let us experience mindfulness. Can we play the music now? The Tibetan healing sounds. Yeah. Now, after the meditation, please write down. Same feelings coming up. How do you feel? Is there a change? I'm just putting up this very same thing, but now after. Can we have the PPT slide, please? Yeah. So after this, how do you feel now? And I need. Same feelings which I put up for the before. Same feelings you're examining now, but after the meditation. Let us go on slideshow now. May I now request some of you to share the experience? Please be free to share. How did you feel? Was there a difference? Was it the same? The before after words that you used, are they different now? If they are the same also, you can tell me. Would you share? Who would like to share, please? You felt? Calmness, okay. Thank you. Anybody else would like to share? Okay.
I felt very happy. Music was very soothing. I saw the slides which had beautiful scenery.
Thank you. Online, I know. Thank you for that. Anybody else would like to share? If you had gone for another 3-4 minutes, you would have been very happy. But then we're all running against time right now. But then the intention behind this exercise was, one, let it be experiential by nature. And secondly, it is that you can use it in the classroom. You do not need more than a minute for this. If you can get children to relax, put by everything, and ask them to drink plenty of water one period after the other, and then do this, you'll find very, very good calming effect on children, for the teacher also. Because you're coming from one class into the other class. So you'll have to put behind that experience and come into a new one. And we found this to be a very powerful form of getting ready every time. And children seem to be doing better because of this change and the way the thoughts are now getting organized, right? I'm not saying this is 100% failure-proof thing, but it is one of the strategies we can use for mental well-being in a class, where children can begin to relax, when they begin to examine internal feelings, like many of you said, we were introspecting and going within ourselves. Very, very important to do that, because we very rarely spend time on going into ourselves, isn't it? Thank you. So we will move on. So when we do daily mindfulness, my focus is on the mental well-being. So I'm looking at 6 very simple activities which you can look at for focusing on the mindfulness, because mindfulness is a very, very powerful method of mental well-being in schools and classrooms. So I'm trying to suggest some activities we can do. You can kindly note it down as I give you one by one. The first thing is what we did just now, and that's called mindful breathing, right? So this is great for bringing the mind back into the breath, and you can ask them to breathe deeply. If you don't want the 5 minutes, it's fine. And ask them to count 3. The most important thing in mindful meditation breathing is, we tell children not to hold the breath. Any form of breathing, whether you do pranayama or whatever, there's no holding of breath. You breathe in and you breathe out. So that's one very important thing we have to remember, to never hold the breath. You don't have to spend all the 5, but ask them to take a deep breath and inhale and again exhale, depending on their comfort area of counting of 3 or 5, depends on the lung capacity. So it doesn't have to be frozen with the 3. They could even take some more time to breathe in and breathe out. It's perfectly all right. And put the hand on the stomach or on the thighs to feel the way the breath is going. That awareness of breath is very, very important for all of us. So this is one strategy we can try. The second one I'm looking at is color breathing. So this is very important that when children are doing mindful meditation and relaxing, ask them to think of a color that helps them to relax. Now, this is not that everyone will think of the same color because we all have our color preferences. So when children close their eyes, ask them to try and bring in an image of a color that they like a lot. And another color that represents anger, what kind of color would come? When they're frustrated, what kind of anger? When they're feeling sad, what kind of anger? Why it is important to know that? Because when they try to find out these colors, whatever is negative amongst them, if you look at anger, if you look at frustration, if you look at sadness, versus feeling relaxed, feeling good, feeling that people are supportive of them, those kind of colors, they should constantly visit and get back. And these colors which come in their mind of anger or frustration, children should learn to manage them. And we cannot control anger, we cannot control frustration. We learn to manage this. We learn to manage and we move. Yes, you can use the Jnana Mudra with your index and thumb finger, keep your hand on your thigh, perfectly all right. But otherwise, it's also important to focus more on the breathing with your back straight up. So anyone is comfortable with mudra, it's fine. If they're not, perfectly all right, but don't bottle your hands together tightly like this, because this could be an inhibitive factor, may not allow the breath to go in. They say that whenever we stand like this, it could be very indicative of us becoming very defensive and not allowing anything to go into us. So just relax and let go. The third one we are looking at would be the 5 senses. When children do mindfulness, one day you could do the colors, one day you could do nothing but just the breathing. The third day you could do the senses. Ask children to close their eyes and take deep breath. Would they look at 5 things that they can actually see when they close their eyes? What are 5 things that they think they can touch, or they can hear, or they can smell, or they can taste? So the mind is so powerful, it can start generating all these kind of feelings within us. Whether you can actually touch a soft flower or not, the moment you auto-suggest and say there is a very soft kind of flower next to me and I can feel it, the mind will enable you to feel the softness. So one day you could work with the senses, which is also very significant. Another one, I'm sorry. Yeah. So then we'll go to the next aspect, the 3 things I told you. Now I'm trying to focus on mental wellness. One of the first things we're going to look at is when we talk about mental wellness inside our classrooms. The focus therefore will be another terminology that comes in called a conducive learning environment. Because if the learning environment in the class is conducive, then we'll all agree that it enables children to study or to concentrate or to participate or to get engaged with the teacher. For the teacher also, a conducive learning environment must be brought in so that the teacher and the taught both are engaged into fruitful learning. Therefore, I'm trying to focus now on what do we mean by a conducive learning environment. This is a platform that's devoid of the physical intimidation and emotional frustration, and it should allow a free exchange of ideas. Children should never feel that when the teacher is asking a question, I don't know it, I feel very intimidated. I feel inadequate. I don't know that answer. But there are many in my classroom who know it. Looks like I'm no good. Children should never feel that. And how does the teacher manage it? She's got to provide a supportive environment. We'll take a call on that. But first, I want us to watch this video before I show you 2 pictures on the next slides, which are going to contrast each other, and we will now discuss with your interaction. This is one of the best videos possibly on the UK Trauma Council. I want us to watch on how childhood would affect children. May I request you to? No, I've given it to you. Just play that. Among the videos I sent, one would be this. Yeah. In a folder, right? No. Not that. This one. Yeah.
This is a short story about how war and conflict can affect the way young people see themselves and the world around them.
This is also a story about seeing a future after these experiences.
The content may be emotionally difficult.
Please think about how you feel before watching.
It happens when I least expect it. I can be out having fun with my friend when out of nowhere, a noise or smell pulls me back into the past. No one else can see the cracks in my world, but they're always there.
I hide myself away, but the memories always find me. The more I ignore them, the larger they become. The world feels broken. My head aches.
I want to fit in. I try to act normally. But I never know when something will suddenly shatter my world into pieces. My past won't leave me alone. I feel so angry all the time.
Life is hard here. I'm always so tired, but I'm too scared to sleep. Because that's when the nightmares come. Make it stop.
I feel trapped.
Why do I feel so angry?
Make it stop.
I hate it here. I can't sleep. I'm scared.
I feel trapped.
Why do I feel
Leave
so
me alone.
I feel trapped.
Scared.
There was a moment when I decided to stop pushing the thoughts away. I began to face my fears. I realized that I could change, that I could start to take control. All these pieces are part of who I am, but they don't tell my whole story.
Sometimes life is hard, yet I can always find something to be thankful for.
The painful feelings after war and conflict are there for all of us. But they don't last forever. Each day is an opportunity for change.
Although it can be easier to keep things buried, finding even one person you feel safe with, who understands your story, can really help. It's possible to learn something even from the most difficult of experiences. It can take time to put the pieces back together and to realize that although the past will always be a part of you, it doesn't have to define you.
Your memories may shape you, but they are not your future.
So what about you?
What will be your next step?
To find out more, visit here.
So I want us to now reflect on this video. What does it tell us? Not necessarily about war, but about our children, especially our teenagers. What does the video talk about? What does it reveal? What can we do as teachers? Would you like to write down and then speak? It will be very nice. Can I give you about 30 seconds to write down what you found in the video? Could be useful in understanding our children in the classroom. Right? How does this video help us to understand our children in the classroom? Maybe second would be, then how do we help as teachers? After you write, we'd like you to share your thoughts. Online also, I request all the members to look at I think you've all viewed the video along with us here. So the two questions I asked, you would kindly answer now. How would we use it with our children in the class? Right? What does that video signify? Give us your thoughts on that. And then we'll begin the sharing. So we'll begin with responses. Who would like to answer? We like to pass a mic around. Shall I send mine? I'll use this one. Fine. You can pass it around. So can I request members to kindly share? Anyone who's ready?
So in the video, two children, a boy and a girl, both, for both, past is haunting them. So they are much worried about the past. They cannot come out of that. That is the feeling they are having. On a fine moment, both of them decides that they should not be stagnant over the past. They have to come out of all the difficulties they have, all the memories which were haunting them, and they decide that each day is an opportunity to change, and they are deciding to change. For that positive change, they are ready, and that will surely make up their future.
Add on anything different? Another perspective of the video? Just raise your hand. Yes, sir.
Having the same type of difficulties.
Please go ahead.
They have a different types of traumatic experiences. There is a differences in it, and they come to they wanted to put out these negative feelings. They want actually it's not by the single one. Collectively together, the sharing is the most important to more this experience. Pent up emotion should be there. That is one of the first way they have been found. And what are the different types on the different ways in which they are planning and they will be doing it.
Thank you so much. Another perspective come up.
Here, what I noticed is it is very common that everyone has their own problems, stories, but that problem should not hamper the development or growth or progress of the child or any individual. So everyone should feel that there is a light at the end of the tunnel. Yes.
So did you get some strategy to pull them out the tunnel? He said he came out of it.
There is one line where memories should not
Put the memory
behind.
So
Yeah.
should teachers work on strategizing this in the classroom, that we
Enable our children to put their memories, the bad ones, behind, but take the learning with it. Put the memory behind, but the learning comes with us to progress. Thank you for that summary, sir. Can I have yours, ma'am?
I too wanted to share something alike.
Sure.
But in this, how the children are tackling with traumatic situations,
Yes.
thinking that this is the time, they realize that it is now. The past is gone and we should not brood over it. Though the situations are different, forget past and work towards the future. They realize by sharing. No, in a present they can share with each other and realize that this time now is the time for the change and look for.
So that's the
future.
word. The key word is sharing. They were all alone prior to
Yes,
that.
they were
They
sharing.
thought I don't have anyone, nobody's there to help me. But the moment they began sharing with peers, one, they realized they're not alone.
Yes.
That there are many people having their own different forms of trauma, but not the same. But they realized trauma is trauma, and each one started supporting. Is that what we would be looking for in schools?
Yes.
That our peers have to become so strong. Somebody spoke about how can one counselor handle so many people. Peer counselors are powerful these days, because today there's a lot of focus on peer counseling. And it's not that the child who's so-called normal is going to help the child with a problem. Two children with different problems can also support each other and come out of it. That's very important. That phrase, light at the end of the tunnel, is a very significant one. Thank you so much.
Thank you.
I'll take another call and we'll move on. Yes, sir. Okay, there is someone. Yeah. And then we'll come back to you, sir.
Online.
Yes, there is a request. We'll read it now.
We have a comment: live the present, never worry about the past. It is gone by. Future is in our hands to shape.
We have reflection. Another one.
One more we have. Sir says we can advise children to not get worried about the past, always which has happened without their role. Bitter experiences should gradually fade out from memory. Sorry.
Fine.
From memory to enjoy beautiful life ahead. One more response: sometimes life is hard, but it is not permanently. We have to face every problem and to learn from every problem out of it. One more response we have: we should make the children realize that worrying about the past is of no use and not to feel guilty about the past in which they had no role.
Lovely thoughts and reflections, but what is very important here is saying one thing is, I mean, it's very good, but enabling that to happen in our classroom is the strategy. So we have to make children know that we have to be with them, walk with them, and it's not words that's going to matter, but the supportive system that how do you come out of that mental shift, that I put the past behind and I come to the future and walk on, because that is more important. So a lot of talk by the teacher, pep talk, hand holding, one-on-one with the children, walking along with them. I think all this together will enable putting back that past. Believe me, many of us who could have had similar experiences, it is not easy to put back the past. It's easy to say that. Put the past and come forward. Very easy to say that. How do I get a little teenager to put back the past, the traumatic experience? For that, we need to handhold, console, to support, give them words that will give them hope, and handhold the little changes that could happen. Because this cannot happen overnight. It takes time, it takes patience, but we need to do it because these children could be living in another world without hope. So as teachers, it is our responsibility to slowly bring them out of that tunnel. Sir, would you like to add on so that I can move on? You're fine? Very good. Thank you. So we'll move on with the presentation. Thank you all for your contributions. Matters a lot because that's what makes the session more of internalization than one person.
Okay.
मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844
Those two there.
063.
They built a tower or something in the class as part of a project. How do they look? They look very happy, they look very content, they feel they've done a lot, right? All right. So would this be happening in our classroom sometimes? Right. So how would you comment on the teacher managing in your class, you just let go, let the class go on. It could be happening. So what do you think the teacher actually should be doing? If someone can tell me, if she really wants to see all her children engaged, what do you think she must be doing? Yeah, we could do multiple activities in a class. Like multiple intelligences, you could do multiple activities. But what is the role of the teacher when she gives that? Yes, sir. So when she facilitates, she's got a class of 40 or 50, that's quite a challenge. How does the teacher ensure that everyone is fruit? Okay, sir, she will make her groups. She will design very good activities for all of them. Very good. How does she ensure? That's what this teacher has done. She has designed multiple activities, right? What do you think she should also do as a teacher?
Taking their interest and need into
come again, ma'am.
Taking their interest and need into mind consideration.
Yeah, probably she's also done the interest level analyzer and put the children into projects similarly. But then, what is she doing right now after dividing her class? Exactly. So we are going to work on that. Can she ignore the entire class and focus only on one?
No, she's observing the whole class, observing the activities of the whole class.
Exactly. She's got to monitor, it's not just facilitating, but she's got to monitor because she has designed the activity, she has put the children into groups. Can she monitor who's doing what? And find out, sometimes we design activities, let us be very clear with ourselves. Then as teachers, we do activities of multiple group, multiple variety. You find your design seems to be good with you. But when it is executed, do you find one group getting bored with it? Yes or no? Clear, and maybe the activity has not engaged them adequately. One group feels really charged, the other group feels bored. So this is the kind of feedback the teacher has to feel the pulse of the class. So if she lets everyone go and she focuses on one, very shortly she'll find children like this, sleeping, sitting up, and she may not even know. And that is why, what kind of well-being is happening in this class? Do all children feel good now? No, when we talk about mental well-being in schools, an activity has to ensure that everyone feels what about an activity? Let's take an E called engagement, right? Everyone should feel I'm totally absorbed in that. That's called being engaged, right? So when I give an activity as a teacher, can my eyes go around the class to all the groups and see that everyone is totally engaged? They seem to be fully engaged in that. What's the other thing that should happen? What do children like in activities? Another E is there. What's that? Children need to feel
appreciation.
Appreciation. I'm talking about another E, ma'am. Yeah, okay, sir, I'll take entertainment. The third one, you say go to the games ground now. What's the feeling that comes? Excitement. Children need to feel excited about what they are doing. When they feel excited, when they feel emotionally excited, they put their 100% into it. When they feel emotionally low, they will go to sleep or start fighting because they have nothing more engaging to do. Are we getting what we are saying? So when you plan, you have to kind of simulate your class. When I deliver this activity and I want good well-being to happen in my class with happiness, do I know whether this activity will engage everybody and do I know that it will excite them? Two things a teacher has to watch out for. Are we okay? Everyone? Okay. So the next picture, tell me, this is a school. Same questions I'm asking you. You can observe various things happening in the school without names though. But what are the actions that people are doing? So what emotions do you think they are undergoing? Who all are involved in this? And how do you think the learning is going to be impacted? Tell me. Take each group. There is a group here with a person. Then there is a person there attending somebody. She's got a plus mark, which means something to do with the medical side. There are two people, a teacher and a child. There's somebody sitting on that bench. There are children playing. You can see inside the school a little bit. The entrance, somebody going in. So overall, what kind of emotion can we see? How are the children here? Involved or engaged, correct, sir? Do they look excited like we said in the previous picture? Yes. Are all of them looking excited? Exactly. So when the teacher is, let's look at this person. This is a very important one. In this very engaging thing, what's happening here with the child with the red cap and the man there? How is the child looking? Looking very sad. So what is that teacher doing? Or that adult? He's trying to console that child so that he feels better. There's one child who's injured and who's crying. Sorry, sir. No, sir. Please look at the teacher's face. I agree with you, sir. Look at the teacher's face. Does he look like somebody who's giving a punishment? Or does he look like somebody who's trying to pack the child into normalcy? Let's look at facial expressions. Yes, sir. Does he look like he's going to take a stick and whack him? Yeah, but he hasn't touched the ear, luckily. He seems to be patting the child and the boy is trying to pull him out of the trauma, maybe. What's happening to the lady there with the red sweater and the little child? She's giving a high five because the child must have achieved something very simple, but both are celebrating. So do we as teachers celebrate small successes of our children? We need to celebrate that with our children. We take sometimes success for granted. Can we pause and celebrate? What's happening on the bench out there? Are they enjoying the reading together? That's another engaging, exciting thing. Right? The teacher there with the pyramid, what's he doing with the girl at the top? Helping her to balance, and he seems to be also applauding. Look inside the school. Does it look like a happy school there? Everywhere? So this is where we have to find out how do we as teachers work together. If you look at the Bhutan curriculum, they say number 1 in the world is Bhutan on happiness index. Then you have the countries in Europe, Denmark, Scandinavia, Finland, all the countries of Europe, they come next. India comes quite way down on the happiness index. And if you look at great countries, Canada is a little better, America's way down on the happiness index. And so is Australia. But New Zealand seems to be better. What does this indicate, this kind of statistical data? Why are people happy in these countries? Why is Denmark called a happy country? Why is Bhutan number 1 in the happiness index? Because people there feel happy about what they do, right? Everyone is involved, adults and children alike. Adults are conscious that children are the future of the country. They need to take them across very carefully. If that kind of conscious curriculum comes into our classrooms, you can be sure that engagement will lead to productive, very healthy children who come out of our school. So the teachers have to be very, very conscious about what we are doing inside. So the 2 things we are looking at and very important is, how do we promote well-being in our schools? And sometimes after a program or some training, we decide to start on mental well-being in our school with some strategies or something. But what is very important, I would say, my dear friends, is it's good to start, but it is very important to sustain. And that's why even the UNO says sustainable developmental goals. You don't just start off something like a firework and get done with it. You need to sustain. So there are 2 things we need to look at. How do I promote well-being in my school when I go back? How do I sustain that well-being once I started in my school? How do I look for indicators that will help me to sustain? These are 2 questions we need to answer. So we're taking an activity here, a survey. I want to know from our group here, maybe the ones who are watching us online, how many of us here, can I go to the next slide, please? Ma'am, the next slide, please. How many of us here have begun measures to address mental well-being in our school? Many of you would have started. How many of us need to begin? We have not yet begun. Thirdly, I want to know those of us who have started very small ways of mental well-being measures in our school, can you share it with us? Right? So I'll open it out to you now. How many of us have begun small measures on well-being in our classrooms? You have begun, ma'am? You have started.
Yes, ma'am. Yes, ma'am. The child who was physically weak could not concentrate so much on her study, but her elder sister was also my student, very bright, very bright. Right. I used to talk to this second girl with great love and affection as my own child. And there was a lot of improvement in her behavior. If any problem she had, if anything she had to share, she would come and talk to me. And she was very friendly with me. And this happened in the other school where I was working. I felt very happy that there was improvement. Parents were also happy with the relationship I had with their daughter, second daughter.
Wonderful. Thank you so much, ma'am. I think you deserve a hand for the kind of initiative you took in all the schools that you work. Wonderful.
Thank you, ma'am.
Could someone here, I think two of you raise your hands. Would you like to share, ma'am? I'll give you the mic.
So what do you do, ma'am, to start well-being in your school? Your own ways of doing it.
Some children who are poor in studies or constantly not writing notes, do not submit notes. Complaints are coming from those children, from the teachers about those children. Calling them every day, patting them, talking to them, and giving them small chocolate or anything for writing at least one page and for a small improvement, and talking positively in assembly. That is, you can do. That's almost every day I'm doing.
Those magic words, you can do it. You can do it. It actually means a lot to children because it's coming from an affirmation from the teacher, right? And you can do it. You're capable of doing it. Very good. Thank you so much, ma'am. Lovely thoughts. Ma'am, can I have your sharing, please? And anybody else here? Please don't hesitate because we're all learning out of our sharing. Ma'am? Yeah, I think she raised. Madam? The one who's writing. Could you share? You want to share your well-being measures in your school? Go ahead, ma'am. Like to invite others also. It will be good to share.
Ma'am, under adolescent education program, like high school, first we got them to write about their problems or this. We didn't even ask them to write their names. We just had a box, put their problems into it. Then we took it up. We teachers discussed about it, and then we had an open session where we spoke to the children in general, like some problems every child had, like. Then some things came about bullying. We never even knew that such a child could bully. But when many of them are saying he was like a silent person, bullying children in different ways. So we spoke about bullying and respecting each other's views in high school. So many then about the affairs, liking and all that. We had a counselor. We had called a counselor to speak to the children. We had open sessions with the parents, because some of them were telling about how the parents were comparing each other. Yes, not only siblings. Like then we stopped giving a general marker. Like when the PTM, we used to have the mark sheet where all the children and then the marks to sign. So we stopped that and we gave only individual cards. So some of the parents, they started comparing. And so we had a session, open session for the parents. A counselor was called, special counselor was called, and there was a counseling session for parents and for the students. It was not only us, ma'am. We had first some session with the teachers and children. But certain issues, yes, ma'am. So yes, certain issues we thought we need an intervention of a specialist. So we called a person. And then we really feel we need a counselor in the school. We started for the primary, but now that madam is not coming, so I think we have an interview today actually. In our school we have an interview. Maybe we'll be getting some. Thank you.
Anybody else would like to add on? Any other good measures you're doing in the school? Please don't hesitate to share because we're all here to learn. I think it's very important that you share. Anybody else? Please share.
Hello, madam. In fact, in our Vidyalayas, what happens, we are not only subject teachers, we are also the wardens. So we have to play two roles. One side to get marks and this academic performance, there we will be strict. But as a housemaster, we are the parents of the child. So both the ways we have to balance. So in that case, when we visit the houses, that is dormitories, yeah, we have a happy heart like that one session. So we spend nearly half an hour, never talk about any subject or anything. So freely they can come talk, they present whatever they like. Because what happens when there is some competition, we select only those who get prize for the house and others are neglected. But this happy hour, what happens? Everyone is allowed to participate, whatever they like, they do. So that is a strategy where children are happy in the house.
Beautiful. Thank you so much. So we will move on. The next slide, ma'am. So now we come to the rationale. Why should we be improving mental health in schools? We'll show you another video for that, a very good one.
Where Anna Freud, who's, I think we've all heard of Sigmund Freud, his daughter, she gives a kind of a revelation to us. Let's watch this. Why should we be really working on mental health in school? The rationale. Let's examine that.
Mind Matters in Minutes. What is mental health? Part 2, Why Schools? School. If you wanted to improve the mental health of an entire population, one of the best places you could start is at school. For one thing, most of us go to school. For 10 years of our lives, we have this one thing in common. So it's a place where you can pretty much catch everyone. High school in particular spans a crucial and often challenging transition into physical and social maturity. It's a time when some young people are vulnerable to stresses and in need of support. Research has shown that protective factors developed in school can help all students, and they can also offset risk factors from elsewhere in a student's life. This means that for some students, school can be a haven. Actions taken in school can have a big impact on a student's well-being, not just in the short term, but over their entire lives. And the effect is not limited to well-being. Mental health is a foundation of school achievement. Positive mental health can translate into good behaviour, good habits, good attendance, positive community, and good grades. If every school were producing students with good mental health, we would see a ripple effect across the entire nation for everyone's benefit. Mind Matters is a framework that helps school staff at every level make this vision possible. It is not a program to turn you into a mental health professional. You already have a job. It's not a set of lesson plans. Instead, Mind Matters is a way of approaching what you already do on a day-to-day basis. From the way you smile at students, to the types of conversations you have in the staff room, to the opportunities you take to empower your students. Using the Mind Matters framework, school staff can take a strategic, targeted approach to mental health. Better outcomes.
Somebody out there has to. Ma'am, if you can mute, it will be nice. But they can't hear our conversation if you mute. You can? We're not able to find out. No. This is the worst place. We can't be raising our voice and asking them to stop. Is there some coordinator? Excuse me. Can you kindly please mute your Please mute yourself, sir. Madam, please mute your mic. Thank you so much. It's disturbing us otherwise. All right. We just saw the way the video clearly expressed that mental well-being, when it starts in the school and children are growing from 3.5 to 17 plus, they undergo different stages of the major parts of the life, including the teenage times. They come into society. So whatever we bring out into society, it matters a lot for us, right? Let us be very conscious of that. Somebody has to handle this. Now let us see the next step. Can I go to the next slide, please? How do we build? So now let's look at how are we going to now build a positive health, mental health in our children, especially in the teaching learning process. So first thing I would look at, I think you've got to keep moving the slides with me, ma'am. First, you have to create a mental health friendly environment. And most importantly, what we mean by a mental health friendly environment is where students are not afraid to open up and talk about their feelings. So children must have that liberty, that freedom in the class to express, like you're expecting them to focus somewhere. They could take the liberty of saying, I'm not too well, I have a headache. They need to have that liberty and they cannot be scared and tolerate when they're under a lot of stress. So they must be open to talk, and also when some kind of discussion is happening, are you trying to, as a teacher, go around and look at the facilitation that you're doing, that every child is finding a voice in discussions? Because many times in our classrooms, what we find, we give group activity and the groups are split. The children sit down, 1 or 2 will dominate, 1 or 2 will try and participate, some are non-participants. I think we all have noticed that. Now it's very important here for the teacher to go around and ensure that every child in that group taking up that will not be afraid to express their opinion, express their ideas, so that as a team they work and everyone feels good during the presentation. As teachers, we all must have observed this happening, right? Some are quiet and some are very active. The second thing we need to do is, you need to talk to children very importantly about that decision-making skill. They take very, very informed choices of hard work and learning from failure or mistakes, because failure is not final. It is only giving up that is final. Failure can never be final. It is only one of the steps to better learning. Let our children know that and support them through that process. When someone doesn't do well, most often in our own subjects, as teachers, we get emotionally perturbed. I think I'm a good teacher, but something went wrong with your learning, right? So we tend to shift the blame that side, maybe ego or whatever it is. We do not accept that there could have been a gap in my teaching also. It's very important to be humane about this, to find out where do you think there was a gap in your learning. Is there some way by which I can support you? That's more important than the fault finding process. So when children feel that the teacher is not cornering me and the teacher is always there to support me, the child feels good in your class. And that feel good, the teacher has to promote all the time, very, very consciously. The third one we're looking at is, you must be able to bring your health sessions into your classrooms. So have a block every day for some mindfulness. I told you, you don't even have to take a period of it in your life skill class. Every class, all teachers, just 1 minute of time for mindfulness breathing. Tell children to talk about how you feel now. Would you like to share your feelings? Give them some sharing time, then start your class. They feel really good. They can sustain the 44th minute very well till the 44th minute. That first 1-2 minutes when you enter, they make a lot of difference. Because I think one of my gurus who actually made me what I am today is Mr. G. Balasubramaniam, who was former director academic CBSE. He has groomed me quite a lot on my training skills. One thing sir used to always tell us for teachers is that when a teacher enters the classroom from the door, see, one teacher has left, other teacher is entering. He says those first 10 seconds when the children watch the teacher entering that class, right? The fate of the class is decided. They look at your body language. How is this teacher entering my class? Is that teacher looking at all of us and smiling? Does the teacher look very keen to learn along with us? Or is the teacher coming with a slouch, looking very upset? I had a terrible class before that, a complaining type of teacher. He says within 10 seconds, the fate of your class is decided. So I think as teachers, before we enter the door, can we take a call that this class has to be good? I'll put my past behind me. And only as teachers, if we demonstrate mindfulness in what we do, we can expect our children to also demonstrate mindfulness. Would you agree? Because children just imitate what we do. You look dull, the class becomes dull. You look happy and excited, the children also get happy and excited with you. So this is a very important aspect that we do on mindfulness. The next one is that children have a lot of negative thoughts, already explained by our counselor in the morning. The lady who very beautifully pointed out how many negative thoughts actually bulldoze these children every day. Now help children to understand those thoughts. That's why mindfulness matters. Children must not push their negative thoughts into some corner of the mind and say, let it be there, this is not good for me, let me try and become positive. No. If there are negative thoughts, a child has to grapple with a negative thought. As a teacher, can we tell children it's okay to have them and to work on those thoughts so that they're able to come out of it? Only when the teacher recognizes that it's okay to have negative thoughts and it's okay to work on them and push them out and bring in positive, the child will see hope. Otherwise, they cannot see hope at all. We need to enable them to see that hope when we talk, right? The next one is we need to educate ourselves about, when I look at my class of 40 children, am I actually looking at every child when I am teaching? Am I having eye contact with everybody there? So when I look around my classroom, what do my children's faces reveal to me? What do I understand about my class? How long do you think it will take for you to take a quick glance around 40 children? How long? That's it. Let's say 1 minute. But is that enough to kind of know that somebody looks upset, somebody looks happy, somebody looks indifferent, somebody looks like they're happy or not happy, neutral? Lot of emotions can be seen. Now, as a teacher, we know that we have to create some kind of activity which will start pepping up the class. We never know what kind of a class they had prior to your coming in, how bad it was. We don't know, maybe a tough test, and they're all still grappling with that. Why are children afraid of scores? Who are they afraid of? Not teachers, for sure not teachers. Who are they afraid of when they do a test badly? Parent. So all the time, the child who has done a bad test, for whatever reason, in your class, the previous class had a test. In your class, they don't concentrate because their mind has gone to the home. They're imagining conversations with the parent, the scolding by the parent. They're in that world. They're not with you. So the eyes look like they're focusing on you, but they are somewhere else. So this teacher has to create engaging activities, not necessarily textual based. That's why we come out of all that. We're looking into pedagogical structures in our classroom which are engaging and exciting for children. It could be any kind of pedagogical structure you're looking at. But make sure you're involving all the children, engaging all the children, and one look will tell you whether they're looking dull, they're looking bored, what are they doing with your class. That's very important to understand the pulse of our children in the class all the time. And the next thing is, as already pointed out by the speaker in the previous session, children need to know why it is important to sleep well, why it is important to eat a good diet, the importance of exercise. So whenever you're in the class, when you do a mindful exercise, you talk pep talk, good words come out of you. We are becoming demonstrative of what we want children to be. The teacher has to be the leader here. Demonstrate what I want my children to be. I can't do one thing. I can't be negative. I can't be scolding. I can't be putting down children and then expect my class to be active, engaged, and positive minded. Is that possible? One way that everyone should be happy, but I can scold the children. Will that work? No way. It has to be a negotiation where, one, your classrooms rules are framed very clearly. They are non-negotiable, no doubt, but at the same time, they have to be compassionate. We must remember we are dealing with children, not machines. Would you agree? Yes or no? And the biggest fear that child has is that parent out there. Yes? Because parents feed children with a lot of unwanted ambitions. And sometimes children feel hurt when parents say, do you know how much of fee I'm paying for you? Do you know how much I spend on your education? Do you know this? Do you know that? And children come back and say, I hope one day I'll get a good job and I'll return all that money back to my parent. I asked my parents, can you take that day when your child throws the money back on you? And said, that's it. You gave me money, I'm giving it back with interest. Now let go. Would we like to let go our children when we are old? No, that's the time we want to cling on to them. You have to lay the pathway for that, to be an understanding parent. Are we getting what we are saying? And that's why sometime back when the UNESCO and the UNICEF declared their 4 pillars of learning, one important focus that they spoke about was the 3 C's that are to be taken away and replaced by 3 more C's, the letter C. The first one is the competition that we have. Yes, children are all the time into some kind of competition or the other. Secondly, they are into what we call a comparison. One child is always being compared with the other, right? And thirdly, the children are under compulsion. You have to do this and you can't do anything. These 3 C's were there, maybe there now. They have to be now replaced. The compulsion has to go into something called a choice. Children must know that I'm not compelled to do anything. I have a choice about the way I take my studies. Informed choice decisions must happen. And then when we talk about the comparison, it has to lead to now collaboration with each other. Children must learn to work as a group, as a team. So there's no question of 2 people being compared. They work, they collaborate, everyone takes credit for success or lack of success. The team works together in collaboration. Right, and what's the third one? Competition. That has to be replaced by the cooperation. Children must now begin to work alongside each other, and there's no question of you are competing with me. They're now going to cooperate and work with each other. Are we getting that? This face-over must be demonstrated by the school in its examination systems, competitions, wherever, that we may have 1, 2 toppers, this, that, but the school is not recognizing competition all the time. They are more into collaborative effort, group effort, removing that, giving children better choices. This is how the curriculum has to be framed in the days to come. Are we getting that point? We have to work towards that. Second thing, be a mental health role model. As a teacher, you have to walk the talk. We can't be telling children one thing and we can't do another. So give them real life examples. Show them that you're also human. You also face stress. And how do you manage it? Show them how you have pressure at home, pressure in the school. Let them not think that teacher is somebody on the pedestal, looks very apparently calm and cool, and then we are the ones who are suffering. Let them know you're as human as they are. And that's why the teacher has to be a health role model. How does a teacher work on it? Share with them. You also face anxiety, you face your pressure, you face your stress. How do you manage as a teacher? Support your children to manage these areas. That's how that collaboration can come between the teacher and the students. Finally, they need to build and connect. This peer counseling. I think today the CBSE also has brought in a lot of emphasis on peer counseling, right? When they talk about counseling, they're not talking about only a school counselor. They're talking about a training program for students which enable children to be productive, good peer counselors. Why peer counseling? I think more than adults, if 2 peers sit with each other and hear each other out, they understand each other better. Any thoughts on peer counseling? Advantages? To each other. How does it help? They find remedies because solace in each other. Exactly. They share. They find they can trust them also. When I tell them, I can trust my friend, I can trust this peer and tell them. Look into bringing in a peer counseling program in the school, because CBSE has definitely recommended peer counseling. It needs a little bit of orientation. And the second thing is, senior students can be peer counselors for juniors. Bullying, all that could happen. Yes? Again, same problem. That's not a contribution to us. The next one we're looking at is how do I teach skills to people? How do I give them autonomy? I'll have to outshout that person now, louder. So we're looking at teaching coping skills to our children. How do I promote autonomy? How do I help them to effectively problem solve? We must all remember 2 years of the COVID pandemic. It created havoc. Many of our children did face trauma in the family. They've lost relatives. They've lost friends. Every family has been touched by a loss. I'm sure you'll all agree. There are families that lost, parents lost jobs. There are families where parents lost elderly people. Almost every family that we know in our school, in our surroundings, lost somebody in that pandemic, right? Now, this is one example where the coping skill has to be taught. How do I cope with the loss? And we know we have children who have lost parents, not grandparents or elderly. There are children who have lost their own parents to the pandemic, right? How do we treat our children with the coping loss? How to cope with that, with the death in the family? How do I handle it? Because children don't know how to handle it at that age. So what do schools do to promote coping and also problem solving? Lot of this must happen in your life skill classes. or your physics class, your chemistry classes, your literature classes, they have to be converted into not just textual learning. They have to be focused on some case studies where children will examine all of these life skill areas, all of these values, attitudes, so that life skill is not a separate curriculum running in the school. It is maybe there, but most importantly integrated into our curriculum. Finally, whenever we have time, before it's very easy to criticize, can we look at how do I offer my language of support? When I speak, do I use language that, don't worry, I'll come back to you later. No, I didn't understand a word of what you said, ma'am. So go to the child, don't worry, it's not complicated, I'll come back to you later. You just be there, I'll come. So do you use praise? You've done a great job. So the previous day you criticized a child and said, no, you're making noise. The child now has changed and become different. Do you praise and listen to that child? Do you encourage? Do you listen to children? How many times do we listen to those voices? Are we all caught up with our own voice that we do not listen to those voices which are loud and sometimes silent? Like imagine if I asked a question to a class and everybody remained silent, because we all like silent classrooms, let us say. Do you think a silent classroom is a healthy classroom? No, it's like a tomb, you know, the place where you bury dead bodies. Only that place will be silent. Classrooms are not supposed to be silent. They are not supposed to be noisy either and disturb other classes. But there has to be a certain decibel of sound, which means children are actively taking part. Like imagine if all of you never answered my questions. Would it encourage me to go on further? No. Your participation is enabling me to go forward. Are you getting what I'm saying? Yes? We need to be actively involved. So take time to get to know the children. Now, what is schools going to do? This is the second aspect of the program which we were asked to focus on. So you got to tell us the time factor, because we've already gone way behind on the lunch break. So how much more time? 10 minutes more. So what I'll do is I have to run through very fast, and maybe I'll share this. All my good videos will not be seen, but I think I'll give Kripa, my counselor, some very good things that she will show you. A lot of things we had for student well-being and integrating it into the curriculum, and collaboration. I don't know. Yeah, because she's got a lot of strategies we'll share with you. SEL is one thing which is now new to schools. I'll request Kripa to take up after I wind up. Why is social emotional learning to be woven into our lessons? How do we use it? What kind of skills can come up in the schools? We want to do that. So benefits, how will community get involved with us? I'm sorry for running through, but now it's time. And if we have time, there's one thing I want us to remember. When the lady was talking in the morning, I wrote it down in my pad. The holistic progress card which CBSE is planning to release shortly. Since I'm also on that committee with the CBSE, we are getting into the release. It's already available, the samples, but how do you actually use them? We're going to tell you. There, one of the most important components connected with this would be, you please ensure that there are portfolios that are being prepared for your children. When we talk about portfolios, we're talking about pluses and minuses of all of the children's achievements, their academic, their co-scholastic, all the complete personality. And why are these portfolios critical for children? I can show you through a beautiful story. Many sessions I've taken that at the end of it, everybody was crying. We will see if we have time, sir. After Kripa is done, post-lunch, if we can just begin with that video and then your last session. Because that is one video I want us to see about two things. How a portfolio becomes a critical document when at the end of every year, a teacher hands it over to the teacher of the next year. So when that portfolio comes from first standard to second standard, it carries with it a wealth of information about children. From second to third, third to fourth. That's how the portfolio has to work. And we will take you through one sampling of how a portfolio became a game changer in a teacher's life. And she will express how that student, she brought a change and he became an amazing personality in his life. We will do that after the break. But because my counselor has got a lot of hands-on activities which we do in school, she will quickly run through. Sir has given us 10 minutes. You have only 10, not 30 minutes. So Kripa will now take over. Over to you, Kripa.
Good afternoon, everyone. So I know some of us are very hungry right now, and that is making us sad, angry, maybe a little irritated, but it's completely valid. Just to reflect upon, some of our students feel this way the whole day, right? What you're feeling right now. And we don't know. It's not just because they didn't eat, it's just how they feel. It is very important that we address all this. We understand what the student is going through and validate their emotion and create a safe space for them to share with us. So I'll just quickly run through. As ma'am told, I only have 10 minutes, but I've prepared a lot. Let's see. So how many of your schools have a SEL program or a specified curriculum for it? Not yet. It's something that you have to look into. It's a beautiful thing. Ma'am oriented me about it, and we have together come up with a beautiful curriculum, right? As someone pointed out in the morning, right? Teachers can't take everything. Mental health of the student, their emotional well-being, because you already have so much to do. Completion of curriculum, test, exams, this and that. And there is a word we use called compassion fatigue, right? It is our profession. We listen to so many people, so many students, sad stories maybe, people coming crying to us, and we use lot of compassion. But, compassion can also become exhausting. And if you are not regulating your own emotions, it might affect you. And you are not well trained in that aspect. And that's why you need a school counselor. And an SEL program would really help you get through that. It's a program just designed to care about your students' emotional and social well-being. So, briefly about our journey, Shishia's journey in SEL program. The first step we did was to train all our teachers in the basic level of mental health first aid. So we can't give counseling as teachers, but where we can very well give first aid. Just like our physical illness, you can give first aid. So similarly, teachers were taught. It was a big program, and all our teachers participated and were certified as first level intervention counselors. Okay, and appointment of 2 full-time counselors. So I do train a lot of school counselors and send them to a lot of schools. The thing that they tell me is they do all work except counseling. If you can reflect upon your school. Here. Okay, thanks. Okay. So they are given administration work, reception work, and a lot of other work where they're not able to focus on the things that they need to do. So Shishya took a right decision to appoint 2 full-time counselors, and our only job is to do counseling, check up on the kids' social emotional well-being. And the next step was to design an exclusive SEL program for Shishya School. This we did with ma'am's guidance and NEP's guidelines also. So I'll just quickly run through. We don't have much time to go through each and every thing. So these are the 5 components of SEL. So first is self-management. How do you manage your own emotions and how do you express them, and the right way to express them, the socially appropriate way to express them, managing certain emotions like anger or any kind of negative emotions. Self-awareness, how aware are you of what you're feeling? Is it the real feeling? Is it a racket feeling? So we have a term called racket feeling, where we might be feeling very sad, right? But we show it as anger. We might feel very angry, but we might be crying. So understanding what emotion that we are actually feeling really helps us. Responsible decision making, as ma'am rightly pointed out, informed and responsible decision making. So you know what you're, it can be anything. You take up smoking, you take up drinking, you know what you're doing, right? And you know what are the consequences it gets you, and you still make that decision. That is where emotional decision making comes up. Social awareness. Social awareness, again, interpersonal skills and everything. So these are our 5 competencies. So this is a suggestive curriculum. We can send our curriculum to anyone. We can share if anyone is interested. So these are, so you can see it is not the same thing for everyone. From K to 12 we have designed in a way what is necessary for their particular grade, and we have different activities. These activities you can choose as per your needs. We can share the curriculum if needed. So learning outcome also. So we have to specify the learning outcome. So K to 2, we can't do much. They should just be aware of their emotions, be able to label them, right? So these things, I think I can run through this. Take time. Yeah. So these are some strategies in SEL. So this is just like your classes, but we do have strategies in SEL where we can, take the topic and make the students understand. So the important strategy we use is talk and dialogue, where we have debate and group discussion. So this debate has helped us a lot, when there's a conflict in the class. So maybe boys want to play basketball and girls tell they also want to play basketball. We have a debate in the class. So girls, 5 members in girls will represent girls team and 5 members from boys will represent boys team. And they have an open communication, and you'll be, amazed from the points you get from them, the way they think. And we have also mentioned the key competency, SEL competency that require this strategy. And circle time. Circle time is a beautiful thing that we do in our school. We have mentors. So each teacher is a mentor and they have mentees. So these are 5 kids from random grades were put into a circle. And we have a circle time where we discuss certain questions like things that makes you happy, what is currently, affecting you, are you stressed about something? And each participant get a chance to answer and share their views and everything. So you can tell storytelling, role plays, case studies, reflective journaling. All these have different SEL components, and we can use multiple strategy at the same class also. So I'll just quickly run through some SEL activities that we currently follow in our school. So these activities also act as an informal well-being check for our students. So we have so many students, we can't always check on everyone, right? So when we give a class activity like this, it is easy to understand their mental health status from that, a little bit at least. So first one we religiously do is mood tracker every month. So kids from 3rd to 12th do this activity. I'll just show you. So as you can see, the first part of this activity is making them list down the different emotions they go through in a day. So it can be a happy, angry, sad, and whatever emotions they go through. The second step is to associate it with a color. And these colors are not always same. So one kid can tell, for me, angry is red color, and other can tell it is yellow color. So it is also, a reflective activity where they're actually thinking about this emotion, associating a color with it. And what we tell them is to draw something, This thing, it is easy to get a printout, but we ask our students to draw something and they come up with beautiful creative drawings and color each day with whatever emotion you felt a lot. And as you can see, they have colored multiple emotions in the same day and sometimes contradictory emotions, angry and happy, or like bored and joyful. So these things help them understand that it is not one single emotion we feel every day. Multiple emotions we can feel every day and it is okay. And we also might feel 2 emotions for the same situation. So one kid came and told me I recently took a decision, ma'am, and I was feeling little sad and, very low. Previously, I would have thought that I made a bad decision, right? But now that I'm doing mood tracker and I understand that it is okay to feel multiple emotions, I understand it is okay to feel sad even if you take a good decision, even if you take a right decision. These kind of insights students come up with, with this activity. It is self-awareness, self-management, and sometimes even social awareness, because kids peep into other kids' mood tracker. They understand what kind of mood the other kids are going through and, kind of develop empathy and kindness among the students. So you can see multiple mood trackers have just. The next thing is letter to self. So this is also something that we make our kids do often. So it can be a letter to your past self, or a letter to your future self. Or think about a time that you were really stressed in school, and write a letter to that self. Different scenarios where students come up with a lot of insights. So I've just removed the names, but you can see. So some letters will be very happy, joyful, this letter, you're a handsome boy and everything. But some letters are very sad, things that I've gone through and and like, oh, I'm very stressed, I have no one, there is no one to support me, all these. So when we read that, we understand what the kid is feeling. Sometimes the kid is not able to open up, they write it down. So it is a wonderful activity. I think you can try with your students. And for third standard and fourth standard, writing is hard. So we ask them to draw something, things that make you happy, things that make you sad, and they come up with all these beautiful drawings. Okay. So these are some activities. So I will briefly, tell you about red flags and yellow flags that we have in our school. So as we previously discussed, as Aarti ma'am also told, that confidentiality is what is very important. And no matter what, we don't break confidentiality. So how much of our students we talk, we don't tell the management what we are talking or what it is. But there are certain conditions we do break confidentiality. We are going to see about that. So first is yellow flag. So yellow flag is like, okay, stop, wait, there is something that might happen here. So yellow flag is an indicator of not an immediate crisis, but the kid can potentially go into a crisis mode, or he is experiencing something devastating that he might need help. So this can be like, parents getting divorced, parents getting separated, or some family member going through prolonged illness, and maybe a pet is sick. So we don't know all this. When your pet is sick, people don't understand. You go through all that and they tell, oh, it's just a dog, it's just a cat. But your student might be going through all that, and his friends might be commenting stuff like, it's just a dog, don't be sad and all that. But if you know, and you know the attachment level of the kid, you can yellow flag. And you can also see them engaging in risk-taking behavior after something, joking about death or like self-harm and all. So what we do in yellow flag is, we term them yellow flag, we just tell the top management, that is principals and vice principal, that this person is an yellow flag, and the class teacher. So other teachers who are handling the student, we do tell them they are yellow flag, just give them a little more attention. Or, if they're not completing homework, it's fine, right? Be little kind with them. And we also have fixed sessions for them and daily well-being checks. And we do multidisciplinary collaboration, that is parents, the class teachers, principal maybe, the counselors. So we are all there for them. So we know that something might go wrong. The student is experiencing something, and we just, are protecting them. The next is something serious, which is what we call red flag. Red flag indicates that there is a crisis. There is an ongoing present crisis. So this can be suicidal ideations or attempts to suicide, sexual abuse, physical abuse, where not only counselors are involved, sometimes law enforcement is involved. So this red flag, we hope it doesn't happen, but it does happen in schools. We can't prevent it. But red flags ensures, again, we are taking immediate care of the students, and we are involving all necessary collaborators inside that. And here too, what is important is confidentiality. So confidentiality we do break. We have to break confidentiality. But to whom we break? Again, parents must be informed immediately. Teacher who's handling the kid, the principal. Not every teacher also. Again, if you break the confidentiality here, the crisis might increase. So we have to be very careful about the red flag. So this is a brief idea of our school counseling program. So again, as I told, we don't break confidentiality, but the management should know what is happening in the school, right? So we have color codes. You can see like anxiety is orange, depression is this. So we have color codes, and we give a number to the management. So this much cases we handled in this month in this color code, right? So they have an awareness of what has happened without us breaking the confidentiality. So for collaboration, the first person we collaborate is with teachers. Students, of course, students as in not the one coming to our session, their friends, their classmates. The infirmary referral, this is very important because kids who are stressed, so ma'am would have talked about psychosomatic symptoms, right? Frequent headaches, frequent stomach ache. So they might be in the infirmary a lot. So nurses tell us, okay, this kid, please check up on this kid. This kid comes often with stomach pains or headaches. And well-being checks. This is very important. Well-being check we do for all class, no matter what, because some kids don't voluntarily come and talk to you. They might be going through crisis. So we have to fix a time. So we are talking to each and every kid in the class, in the school as well. So we should not miss any one kid just because they are not coming in. So well-being check. So casual as well as formal. So casual well-being check is when the kid is walking, you just talk to them. As a counselor, I just get out of my room, go to drink tea, and I'll be talking to 10 people on the way and solving 2-3 issues on the way. So that's how it is. So it is informal well-being check as well as formal well-being check. And as I told you, the SEL activities, the bus driver and conductors, this is very important because, it is another space where kids can experience some stress or they exhibit some concerning behaviors, concerning symptoms, and they can be a very good person we collaborate with to understand the kids' behavior on the whole. So support staff we usually ignore, but they know more about the students. They are also spending time with the students and we have to collaborate with them as well. Parents are important, but if we could solve it within ourselves, we need not involve parents. But as parents nowadays, they take it with little hesitance or denial. Oh, my kid is the best kid in the whole world. You can't tell anything about my kid. Right? So that is also there, but we have to involve parents when it is absolutely necessary. Okay. Ma'am, time is up, but okay. I'll just give. So some symptoms, I think this and all was covered in the morning session where you can notice some symptoms. So these symptoms are behavior, their emotions, the way they talk, and any sudden drastic changes. Or one important factor we miss is the kid is always around you. Right? Whenever you go, the kid wants to ask some doubt or talk to you, try connecting with you, always. That also is a symptom that the kid is going through something you have to be worried about. Okay. This maybe I can say. Things that I should not say when the kid is going through some crisis. So if not a counselor, if the kid is coming to you directly with the... Okay. This, okay. Hello. Okay. So things not to say to the kid when the kid is coming to you. So life is tough. Life is just like this. Everyone goes through. Life is hard. You have to live it. Just do it. You're scared about going on the stage. Just do it. It'll be okay. Ma'am told about this desensitization of whatever you are scared of, but it should not be immediately done. You're scared of talking to people on the stage. You just go on the stage. That should not be the thing. Slowly, small level. Yeah. And you are just lazy, you have nothing to worry about, you're just lazy, you don't want to come to school, so you are making up all these things. This is something. And lot of I talks. So ma'am mentioned to, give real life examples, but that should come not when the person is sharing distress. So when the student is sharing distress, you should not tell, oh, I would have never done that. In my life, I have never done this, or I will talk to my elders like this only. You are doing like this, this is not me. The kid is not coming to you for that, right? After you listen to them patiently, then you can give a real life example. I understand you're going through all this, but when it happened to me, I did this, right? Now you have to avoid this I talk. And telling you don't have it bad. Is this bad? You see people, kids in other countries with no food, no water, you are just worried about something insignificant. Be grateful for what you have in your life. These kind of things, will distress the kids. Things that you can say. So one thing you can say is, what can I do to help? Most problems get resolved here when you ask. It can be very simple. Ma'am, I just want to change my place in school, in my class. Or I want this person to talk to me. It will end there. Asking what would help will really help. Be comfortable with silence. Right? So when the kid is sharing something very distressing, they might pause a lot. But as human beings, we try to fill silences. Silence makes us uncomfortable. Right? We try to tell something that might fill the silence, but don't do it when someone is sharing it with you. You have to hold space. Offer some small company. Can I have lunch with you? Do you want me to walk with you to the class? Some small company or help would really help. Okay, we will figure it out. I know you will find a way out of it. I'm here if you need me, all these things. The role of counselor. So, as ma'am told me a few days back, if you like it or not, the school is going to be run by counselors soon, right? And, counselors play a very important role. If you don't have counselors in school, this is the right time you make that decision, because counselors collaborate with the whole school and they know everything. They know who's friend, who don't talk to each other, all the important information counselors know, and they're a vital role for your school. I think we can end it.
After lunch.
Okay, so we'll do the case study after lunch. I'm just, skipping forward because time is up.
Thank you.
Thank you.
Thank you so much, Kripa. And I want you to share, because